Okay, great. So this chapter about neurotransmitters, okay, this chapter, there are a lot many things, if you see this chapter, there are many things which are kind of, some things are related to your chapter 9 about hormones, okay, and there are certain things which are related to your previous semester, uh, kind of, chapter 7, the nervous system, okay. So I don't mind if you go to your previous presentation or go to your textbook, okay. People who were not with me last semester have joined us this semester, so I don't mind if you just go and read about neurons, read about the acetylcholine, how is it released, because all those things we discussed last semester. So I don't mind you read about neurotransmitters, acetylcholine, read about what is a synapse, read about what is a neuromuscular junction, read about what are synaptic vesicles, okay, read about what happens in the synapse, how two neurons are joined at the synapse, okay, and what else, and a structure of the neuron, and the structure of the neuron. Just go open your textbook, just read the structures, okay, because you might take those things easily, but you never know, every point is important, right? To start with, you have to go and know the basics about, what is a neuron, what is a neurotransmitter, right? What happens at the axon terminal, what happens at the neuromuscular junction, right? So you are supposed, and hormones, just read about secondary messenger system, and just read about steroid hormones, just a little bit about, mix up of everything, okay, whatever is related to, and if you go back to PHSF and read about that, that's going to help you here as well. Just a reading, I think you should do that, everybody, okay. So having said that, as I said, that the whole chapter is about the messengers, okay, the cell communication, how one cell.
Doctor,
Yes, dear.
don't forget to record.
Yeah, I'm already recording there. Let me
Oh,
check
okay,
once
thank you.
again. Do you see a red button?
No, for me it's not showing, but like maybe for others.
Yes, it is. For me, it's showing it. Yeah, yeah, everybody has acknowledged it. It's being recorded. Yes, thank you. Okay, okay. So it's about, the communication between the two cells, okay, how one organelle within the cell communicates with the other organelle, how one nerve cell communicates with other nerve cell, how a motor neuron communicates, with the sarcolemma of the muscle, okay. It's all about that, right? This chapter is all about that, so I will not go into much details, but the basic thing is, so you know what is a neuron. As I said, that all these definitions you can go back and read from the in your textbook itself, okay, from chapter number 7. Okay, so what is a neuron? We know that it's a nerve cell. We know what is a neurotransmitter. It's a chemical messenger. This neurotransmitter could be present between a nerve cell and another nerve cell, like presynaptic nerve cell and the postsynaptic nerve cell, right? I have one nerve cell over here, I have another nerve cell over here. So nerve 1 and nerve 2, right? It can be between the two nerve cells. But this neurotransmitter could be between a motor neuron. If you remember, we spoke about, we have axon terminal, right? And how we have a muscle cell, the sarcolemma. This is sarcolemma of the muscle cell, how they are connected, right? So don't think that neurotransmitter is only acetylcholine, right? We have plenty of neurotransmitters in this chapter. We're going to talk about those. And then, of course, hormones, they're chemical messengers. They control everything in our body. They're very slow, right? They actually pass on or move to to the targets through the blood. That is their basic definition, okay? But then what you don't know is, what is the difference between a neurotransmitter and the hormone? Both of them are chemical messengers, okay? So what happens? Why do I say acetylcholine is a neurotransmitter and I say insulin is a hormone? Why do I say so? The reason is based on, the distance between the two. Okay. Neurotransmitter, we can call a molecule, we can call a chemical a neurotransmitter, okay, only if it's released, okay, for example, from the post synaptic. This is like, for example, this is like an axon terminal, sorry, presynaptic neuron, okay. So I can call, if a molecule which was stored over here, okay, in the synaptic vesicles, okay, I can call this molecule as a neurotransmitter only if it travels a very short distance, and right over here I might be having, the dendrites of the next axon, of the postsynaptic axon, right? So look at the distance between the two. We just have synaptic cleft, right? The distance between the presynaptic neuron and the postsynaptic neuron, right? So distance is very short over here, okay? So this could be called as a neurotransmitter, because neurotransmitter will never ever travel through the blood, okay? But I can call a molecule, I can call a chemical, a hormone, okay, only if it can travel through long distances. Do you understand? Thyroid hormone, produced thyroxine, produced in my thyroid gland, travels all the way to so many other cells, affects the metabolism of the cells, right? And travels through the blood. This is a basic difference between a neurotransmitter and a hormone. Okay. And then what are receptors? Receptors are, we all know that, for example, if this is the plasma membrane, I will have a receptor over here. Okay. I might be having any kind of receptor. Maybe that can be an ion-based receptor, transmembrane receptor, right? So whenever any protein molecule called as a ligand, what is a ligand? Ligand can be, for example, the way you have a key and a lock, okay? So key will be called as a ligand, okay? And this key will be specialized for a particular lock, right? So the key will be inserted into the lock. So similarly, the ligand will be inserted into a particular receptor. So ligands bind to their respective receptors, and then they bring a change here. We will talk about that later on. They can open this ion channel. I'm using certain words which we already know from previous semester. We already know what are ion channels, right? So I assume you know about all those things, right? So ligands are something which can bind to those receptors and then produce a change in that receptor. Okay, so it might basically, usually these ion channels are closed, isn't it? They are closed. The moment a receptor binds to these ion channels, the next thing would be this ion channel will open, right? And it will remain open till the ligand is attached over here, right? And once this ligand is removed, what's going to happen? We are going to have what? The protein channel will close, when the door will be closed once again, isn't it? So yes, so those will be called as the ligand gated receptors, okay, which open and close based on a certain molecule, and that molecule can be a neurotransmitter, a hormone, anything. We'll talk about that in a while. Okay, so this ligand can be anything. As I told you, this ligand can be any chemical messenger, be that a neurotransmitter, or it can be the hormone as well, right? But it's something like it's going to bind to its receptor and then bring a change in that receptor. Okay. Then we used this term previously in chapter number 9 in PHSA. What are secondary messengers, right? Remember, we had a primary messenger as a hormone, which was bound to its receptor, right? But the primary messenger was the hormone. The hormone was a protein-based hormone. Yes, absolutely, CMP. So hormone acted as a primary messenger because it was a protein-based hormone. It was not able to enter the plasma membrane because of its proteinaceous nature, right? And then what happened? Even though it stayed there outside or in the plasma membrane, but you will see that we'll discuss the pathway, how this primary messenger, which could be a neurotransmitter or the hormone, which can bring a change in its target cell through a special molecule called as a secondary messenger, isn't it? So secondary messenger is always present where? Is it present in the plasma membrane of the target cell? No, it's always present within the what? Within the cytoplasm of the next cell, right? And it's specialized because it can amplify the signal. Okay, it can, if for example, if only one neurotransmitter or hormone was bound here, but when all the changes happened here, okay, we'll talk about all those adenylate cyclase and GTP proteins, but what happened, there were plenty of secondary messengers which were produced, cyclic AMPs which were produced. So I just had one hormone here, but look at how many cyclic AMP molecules I have, which can accordingly bring a change in a cell, which we will discuss step by step in detail. What are those changes? Okay. Okay, as I told you that this slide, if you want to read it here, but don't ignore anything, thinking that, oh, I know this. This is easy. Read everything. Don't leave any stone unturned. Okay, read. Remember that. Okay, so I will not discuss this. We all know what is a cell body. This is the cell body, right? We all know what is an axon. Okay, and then we all know what are dendrites over here, right? And then the most important thing, we know neurons, they never come in contact with what? With the next neuron. This is my presynaptic neuron, neuron 1. This is my postsynaptic neuron, right? And here I have an axon terminal which can form a joint either with the cell body over here, or it can also form a joint with the dendrites, which we already spoke about last time. Isn't clear? So where is the neurotransmitter stored? If I ask you a question, where is the neurotransmitter stored over here? It's stored where? Yes. In the yes, yes, absolutely. It's it's stored in the axon terminal in the presynaptic vesicles. It's stored over here, right? Okay. Then within the short distance, within the presynaptic cleft, it is released and then brings the change in the next neuron. And this is called the synapse, right? This is a synapse, isn't it? This point of attachment is the synapse between two neurons, right? So this is a synapse. It is not a space. You know that space is basically a synaptic cleft, okay? Synapse is basically just a junction of the axon terminal, either with the dendrite or with the cell body, okay? And we already spoke about presynaptic and postsynaptic. I'm moving a little faster here because you already have a concept about it, for because we did all this previously. Okay, so are we okay till now? Any questions till now? We're all good. It's a little far. I'm wearing my headphones. Is it far for everyone? What happened? Let me check. Give me a minute. It's good. It's all clear. It's perfect. Maybe I'm not shouting today, huh? Because because I have a habit of, kind of, when I am in the classroom, I try to make sure that, I'm very clear in my thoughts. It's clear. Okay, Alhamdulillah. Then it's fine. I don't need to worry. Let me still check. Okay, looks like everything is fine. Okay, so what are the functions of the neurotransmitters? Neurotransmitters can act on muscles, as we know that, and acetylcholine is an excellent example for that, right? They can also carry, neurons can also carry information to the endocrine glands. Unfortunately, we did not discuss the second part of the chapter 7 last semester. So all these things were discussed there as well, in the autonomic nervous system. But that's okay. We don't need to know all that here. Okay. And what is the action? Once the acetylcholine binds to the sarcolemma, and we know what all happens, and the muscles are activated. Okay. And same thing, once the endocrine glands are stimulated by the neurons, right, and the hormones are released in the bloodstream. Okay, muscle will contract, and all this will discuss in detail the secondary messenger system. Even though the secondary messenger system, we had it in chapter number 9, but here you have it in detail, what exactly is the secondary messenger system, right? So we'll discuss this in detail in the chapter. Okay, how a particular hormone or a neurotransmitter activates or produces a change in its target cell via the secondary messenger system called as a cyclic AMP. We'll discuss that. Okay, that's coming up in a while. Okay, so there are so many drugs, which we use in our real life, okay, which affect these, these chemical communications between the cells. Okay, a drug may affect a messenger, a receptor, sometimes a secondary messenger, sometimes any enzyme, right? So we don't know, we are not very specific about all this, which enzyme, which messenger. So just a generalized concept over here. Okay, but yes, you should be knowing the definitions of everything. If the question says that what is an antagonist, you should be able to define what is an antagonist. You should be able to define as a what is an agonist. No need to know the examples, but yes, definitions are important. You should be able to know what is the definition. Okay, so what is an agonist? Okay, so let's say this is my target cell, this is my target cell, and this is my receptor. Okay, so first of all, we'll talk about agonist, then antagonist. This is my target cell, okay, and this is my receptor. Agonist is anything, XYZ, I'm not bothered to know. It can be a drug, it can be a neurotransmitter, it can be a hormone, it can be anything, okay. So what is important to know is that what happens when an agonist binds to the receptor. That is very important to know. The moment you have an agonist which binds to the receptor, it produces the action. What is the action? XYZ, whatever it is, the action over here. The action is produced. So we say, or the effect is produced. Okay. So we say that whenever the agonist binds to the receptor, it activates the receptor, and the response produced in that cell is absolutely full response is produced. Did you all understand what I'm trying to say? What happens here? Everybody? So we are not bothered here. What is it? Agonist can be anything on this earth. It, as I said, that can be any drug, like your morphines, anything, anything. Or it can be just a hormone, okay? Or it can be just sometimes just a sodium, when the sodium binds to its channel, okay? And when the acetylcholine binds to its channel, right? And the channel is open and sodium can travel in. It can be anything. Okay, so that was about the agonist. Then what is an antagonist? Uh, okay, yes, Rima. I said agonist is anything which binds to the receptor and activates it. That is all you need to know, right? Or you can say it stimulates it. As I said, the definition is more important here. No need to give examples here. Okay. And then the diagrams, of course, this is from your book, so the diagram also you need to know about it. Okay. Now, what is important? We said that agonist competes with the natural messenger. What does that mean? Right? That means agonist can be anything. Okay. For example, if I have acetylcholine, right? Acetylcholine can also bind to the receptor, right? The receptor here. And acetylcholine, instead of that, succinylcholine can also bind to its receptor, right? So at that time, succinylcholine and acetylcholine are competing for the receptor site. Okay, so this is very important, right? So agonist can be, anything can be an agonist. Okay, but in short, what is important? It should activate a particular receptor. That is important. Okay, and then what is an antagonist? Antagonist is something, uh, which is blocking the receptor. Okay, it is basically the moment antagonist will bind to the receptor, okay, no effect is produced. Okay, so there are many drugs in the world, when they bind to the receptor, okay, then nothing, no change is produced in the receptor. They simply block the receptor. Like the moment, if for example, this is a drug A, whatever drug it is, if it binds to the receptor, no response is produced. So drug has inactivated it. Okay, so drug has inactivated it totally. For example, poison, God forbid, a person was bit by a snake, right? So at that time, for example, the snake venom, it will bind to whatever receptor, suppose acetylcholine receptors, it will bind to the receptor. Receptor will not be able to express itself. Okay, so an antagonist competes for the binding site of its receptor and finally blocks it. That is very important. Okay, and in a while we're going to talk about the curare as well. Okay, and the snake venom as well, we'll talk about that as well. Okay, but here this is just the definition, we'll go into details a little further. They are usually structurally similar. Yes, see Faisal, if they're not structurally similar, how will they go and bind to the receptor? Isn't it, Faisal? Did you understand what I'm trying to say? They have, so if they're not structurally compatible, how will they bind to the receptor? Okay, so that's all you need to know. Okay, so no need to concentrate on this. So these two things are very important here. Okay, then you can just read this information. So in short, here the action is blocked completely. Okay, and here the action is activated. Okay, and here if you remember, I told you agonist is something which activates it, but it basically, it kind of mimics the action of the natural hormone or a natural neurotransmitter. Okay, and then binds to that particular receptor and activates it. Okay, look at this. Agonist is bound to the receptor. Okay, and there was a conference, something like, what we read about the enzymes, in the enzymes as well, changing the effect, changing the site of the where when we talk about the sites in the enzymes are very, very important, because the substrate binding site is very important, because the substrate has to bind it there, right? So it basically brings a conformational change here, right? And what happens, this is a turn on stage here. Okay, and a response is produced. Okay, but then antagonist is a little complicated, I will not go into more details about it, then you'll be more confused. Just remember stick to the definitions. Okay, because there are many other things about the competitive and the non-competitive things, and I don't want to go into all that, then you will be disturbed. Remember the definitions. Okay, that's very important here. Okay, so agonist mimics the action of the natural hormone or a neurotransmitter, while as the antagonist simply blocks the action of the natural hormone or the neurotransmitter. By binding of an antagonist into the receptor, it has completely blocked the receptor. But here it has tried to mimic it, whatever the hormone was, okay, whatever the neurotransmitter was. Okay, it produces the same effect what a neurotransmitter is producing. For example, if acetylcholine is going to bind to its receptors, right, nicotinic receptors, right? So what's going to happen? It will, the effect, whatever effect the acetylcholine is producing, the same effect will, the agonist will also produce. So it kind of mimics the action of the natural neurotransmitter or the natural hormone. Stick to the definitions. We will not go with the examples over here, and the types as well, because there are many types as well for the antagonists. Okay, so we are not going to do all that. Okay, is it clear till now? We'll now move on to the classifications. Classification, you should be, these classifications should be very, very thoroughly, you should know all these classifications very thoroughly. Okay. So, classification of you should know the names are very important. Okay. Classifications of the chemical messengers, like we have the cholinergic, we have the amino acid messengers, we have the adrenergic, and we have the peptidogenic, and we have the steroid messengers. right? So these are all different types of the messengers which we're going to talk about. Okay, now we'll go about this one by one, and we'll also talk about which are basically, neurotransmitters, and which are basically only the hormones. Okay, do you have any information about it? Did you read about it? Out of these five,
The
you did.
steroid messenger is a hormone.
So this one is hormone.
Yes, and the fourth, peptide,
Fourth one, the peptidogenic is hormone. Okay, because here,
and the adrenergic.
you know how you can remember it? I'll tell you a small trick to remember this. Okay, the last three are hormones. Okay, let me erase this. So remember the adrenaline hormone, because we're going to talk about the epinephrine or epinephrine here as the hormone, as well as a neurotransmitters. So that's how you can remember it here. So nerve cell which produces adrenaline, okay, because these five, first of all, you have to remember one thing: these five are also neurotransmitters. So all of them are neurotransmitters. N. Okay, but last three, let me get another pen. Last three, so this one is hormone as well, hormone as well, hormone as well. So if a nerve cell is producing the adrenergic messenger, if a nerve cell is producing the adrenaline, right? So at that time, adrenaline is a neurotransmitter, right? But if, for example, your adrenal medulla, it's producing the adrenaline or epinephrine, right? So both of them are, fit in this category. Did you all understand what I'm trying to say? Okay, and then you know how to remember the word peptidogenic. Okay, uh, they are basically short peptides. If you remember, we spoke about in hormones, there are certain hormones which act as short peptides as well. Okay, so here also we're going to talk about certain substances like glucagon. We're going to talk about here, right? That will come here, short peptide over here. Okay, and then we're going to also talk about here what are the neurotransmitters which fit in this category. We're going to talk about, the endorphins, the enkephalins. We're going to talk about, because they are neurotransmitters. And steroid messengers, of course, you know about them, so we're not going to that, you know about them, right? But remember, all five of them are neurotransmitters, but only the last three, okay, they are the hormones. Okay, that's how you can remember it. Okay, so this is like activate the enzyme. This is like the function, what all they do. They activate the enzyme. What happened to this? Where is my pen? No, they activate the enzyme. They affect the synthesis of enzyme. Just read this information, and that's it, right? So this is it. Okay, so neurotransmitters belong to all five classes, and hormones belong to three. So you should be knowing these five like by heart, right? And now, according to the mechanism of action, okay, we know that they activate the enzymes, they affect the synthesis of the enzyme. We know all that, but what is important is how do they activate the target cell? Okay, so this is the same thing, the same information which we have learned in chapter number 9 in PHSF, that steroid hormones, they affect the target cells directly, isn't it? The direct gene activation. Okay, and then we had an exception here. What was the exception? Which hormone was the exception here? Thyroid, of course, right? So remember the example. It's the same thing what we learned in chapter 9. Remember the examples, okay? And then we have, in this category, we have, if you remember in chapter number 9, we said that whatever hormones, were not steroids or the thyroid hormone, rest all of them activated by the secondary messenger system. So the same thing is going to be here as well. But it's just that we're going to add here, as we move on to discuss each and every neurotransmitter, we're going to talk about, different neurotransmitters, how they activate their targets by the secondary messenger system. Okay, we're going to talk about that here. Okay, now you have to be very clear with the two types of receptors. Like, this is the base of, what I'm going to teach after that. So the two types of receptors, okay, to where the neurotransmitters can bind, or even where the hormones can bind, it's for the same thing. So One is like, if this is a plasma membrane, okay, let's say it's a plasma membrane of a target cell, or let's say this is a plasma membrane of a postsynaptic neuron, okay. But this is the same thing what I explained you earlier. If this is my protein channel, if this is my channel protein, okay, it is totally closed when there's no ligand binding, okay. The moment I have a ligand which is bound to it, okay, look at this, ligand is bound to it, right? The next step would be, the because of the binding of the ligand, okay, which can be a neurotransmitter or a hormone, the gates are closed, my ion channels are closed. Sorry, my ion channels are open, okay, and they're going to stay open till the ligand is bound to it. Like this, these are the basic classifications about, about the receptors here, okay. And the moment ligand is going to move away, okay, then only your protein is going, then your receptor is going to be closed, okay. Yes, absolutely. Okay. And then G protein linked receptors. G protein linked receptors are simply the secondary messenger receptors. Okay. Wherein, if you remember, I just told you that here, if this is the target cell, right? If this is the plasma membrane of the target cell, so I have a receptor over here, right? So the ligand, we also call it a ligand, the ligand will bind here. That ligand could be anything. It can be a neurotransmitter, it can be a hormone, it can be any chemical messenger, right? So this is my primary messenger, right? And then there are many sequence of events which will happen here, which I will go along, as we'll discuss that in detail. But by the end of the day, I have a secondary messenger produced here, and this secondary messenger is going to produce a change in the cell. Right? So this, like, basic thing you have to know, two types of receptors are there for all the neurotransmitters or the hormones. It applies to both of them. Okay. So remember, they're sometimes called as a ligand gated channels. Okay. And these one are called as a G protein linked, or you simply call them as sometimes we call them as, you don't have to know the word, the the metabotropic receptors, but you don't have to know all that. Okay. Just remember these, they're called as a G protein linked receptors, or they're called as a secondary messenger receptors. Okay. Now, moving on further, we'll first talk about the acetylcholine as the messenger. Okay, so remember the types as well. So acetylcholine is the main cholinergic messenger. Okay, and this is the structure. No need to know the structure. Okay, now know the names. Okay, cholinergic receptors. What are the two types? The question says that acetylcholine binds to dash and dash. Okay, what kind of receptors does your acetylcholine bind to? Okay, so in your previous chapters, you simply used the word receptor. Okay, but here you'll go one step ahead here. What is the one step ahead here? You are going to just know what are the names of those receptors. You just need to know the names. Okay, you just need to know the names here. Okay, we're going to be, yes, we're going to be more specific here. So there we just use the term, oh, acetylcholine was attached to its own receptor, and the channel opened and the sodium traveled in and all that stuff, right? But here you're going to be asked that what is the name of that receptor where your acetylcholine is going to bind. So the answer is that it's going to bind either to the muscarinic and the nicotinic. Okay, you just need to know the names, but I'll just quickly tell you that why is it called as a muscarinic. Okay, the reason behind this is sometimes called as, the nicotinic because the muscarinic one is the one where it has affinity towards a mushroom or a fungal toxin. Okay, so that means if this is the receptor, okay, where acetylcholine can bind, but this receptor to this receptor of a very toxic fungus or a very toxic mushroom can also bind to it. That's why the word muscarinic. So you don't have to know all this. You don't have to know all this. And the second important thing, which is, which because this sentence is here, okay, Second important thing which is you have to know is that this kind of receptors, you will usually find them in the cardiac cells and in the smooth muscle cells and in the sympathetic nervous system. So this will be, you don't have to know about this one, you have to know about the nicotinic one, okay? Because the chapter is not dealing with this one. We're going to deal with only the nicotinic receptors, okay? So just for your information, the muscarinic one are present in the cardiac muscle cells, in the sympathetic nervous system, and the smooth muscle cells. We're interested in knowing this one. The question says, where do you find nicotinic receptors to which the acetylcholine binds to? Okay, so they are present in the motor end plane. You know what are motor end planes, right? Neuromuscular junction. Remember, I have a diagram for that. Remember the neuromuscular junction? This was it, right? So the motor end plates. This is the same diagram from the last semester, right? So when I said that acetylcholine binds to the nicotinic receptors, so this is what I mean. The diagram which you saw last semester, this is your nicotinic receptor. Okay, this is your nicotinic receptor, which is present in the plasma membrane of your skeletal muscle fibers. So nicotinic receptors are found in the neuromuscular junction. You cannot find them in the cardiac cells, no ways. You find them in the neuromuscular junction. The question says like that. Where do you find acetylcholine can bind to what? Okay, it can bind to muscarinic as well as nicotinic receptors. Where do you find nicotinic receptors? You will find nicotinic receptors in the plasma membrane of the skeletal muscle fibers found in the neuromuscular junction. Is it clear? And where else you can find them? Just remember the name, because we did not learn all this, in chapter 7 last semester. So just remember the name. You can also find them in the sympathetic ganglia. Okay, or you can say parasympathetic nervous system. Just stick to the sentence, sympathetic ganglia. Are we okay about it? Is it clear? So how many types of cholinergic receptors are there? What binds to the cholinergic receptor? Two types, nicotinic and the muscarinic. What binds to the both the receptors? Acetylcholine. Yes, acetylcholine binds to both of the receptors. Forget about the muscarinic receptor. Tell me, where do you find the nicotinic receptor? You find it in the neuromuscular junction, in the plasma membrane. That is all you need to know. Clear? And in the sympathetic ganglia. Okay. Then I really don't want to go with all this. I'll just quickly repeat all this. This is the same thing as I told you. Go to your chapter 6 about the, where we spoke about about the neuromuscular junction and how acetylcholine is stored in the synaptic vesicle. Just read it once. This is the same thing. Okay. But don't ignore. Maybe questions might be asked. So don't take anything lightly. Did you understand what I'm trying to say? Don't think, yes. Okay, so I'll just quickly repeat it. We simply said last time, when the action potential reaches to the axon terminal, calcium infiltrates, calcium enters into this, the axon terminal. So because of this calcium, okay, the synaptic vesicles, which stores your acetylcholine, okay, and what happens because of that? It binds to the what? By the process of exocytosis, it is released in the synaptic cleft. Once your acetylcholine is released in the synaptic cleft, it binds to the receptors, which are called as the nicotinic receptors. So this is my nicotinic receptor, and it's a ligand gated. Remember the one when I told you two types of receptors are there? The channel linked receptors and the G protein linked receptors. So the question says that what kind of receptor is a nicotinic receptor? So you will say that it is a ligand gated ion channel, or you can say that it's a channel linked receptor. Did I make it clear? Are you confused? Yes. Oh my God, you answered it already. Very good, guys. Dana, this name. Okay, so it's a ligand gated channel. Okay. Of course, it's not the second. See, there are only two receptors, either the ligand gated or the The G protein one. G protein one, you will see that there are plenty of things happening over here, and then the secondary messenger is produced. Okay, so you can easily identify the G protein one if the question is given on G protein one. Yes, Farah, I will repeat there. Farah, as I said that, were you with us last semester? I don't think so, no. This is something which we all, explained. I explained, and that's why, I just kind of, was in a hurry to explain this, because we did all this in detail last semester. Okay, so in short, if the question says that where is acetylcholine stored, you will say acetylcholine is stored in the synaptic vesicles, in the axon terminal. How is it released? When the action potential reaches over here, calcium moves into the axon terminal, right? And because of the calcium infiltration, right, what will happen? By the process of exocytosis, acetylcholine is released here, right? And then what is the next step? Acetylcholine will bind to its nicotinic receptor, and the receptor will open, and the ligand channel will open. And the next step, you remember we said that lot of sodium is present outside. It's everything we discussed in detail last semester, right? The concentration of sodium is more outside. Okay, people who were not with us, I'm again telling them, please read it from the text. You have a textbook, right? Even though you might not have the presentations, but you have the textbook. Okay, so sodium is more inside and potassium is more outside, right? So as the channel opens, because of the acetylcholine binding to its receptor, to its nicotinic receptor, sodium travels in. As the sodium travels in, the inside, which was more negative, right, it will now become more and more positive, because sodium and potassium, both of them are inside, right? And your muscle will contract. Yes, muscle will contract. And how all this process will end? All this process will end because your acetylcholine, the green one, is going to bind to its receptor for few seconds, for a very short time, right? Okay, and then what happened? And once the receptor is released, once the acetylcholine is released, the channel closes, right? And then a very important point: what will happen to that acetylcholine, guys? Everyone, the acetylcholine, which is now released from its receptor, that is a very important point. How is this neurotransmitter degraded? It's hydrolyzed by which enzyme? Acetylcholine esterase. Very important point, right? Yes. Okay. And the one thing which we didn't learn last semester, was basically this nicotinic receptor, right? This blue receptor, which you see over here, okay? It has, if this is a diagram for the question, right? So you can simply label it, or if you need to label it, or if you need to identify it, right? So we have how many subunits? It has total 5 subunits. Okay, look at this. It has alpha, beta, gamma, and delta, 5 subunits. But out of these 5 subunits, right, we are more interested in this alpha subunit and this alpha subunit, because your acetylcholine binds to the alpha subunit. So the question says that, to which subunit of the nicotinic receptor does your acetylcholine bind to? It is the alpha subunit. Khalas, no need to know. What happens after that? The channel opens after that. That's it. What happens if the channel opens? When the channel opens, sodium can travel in, potassium can go out. That's all you need to know. Is it clear? Okay. I'm not going fast, right? Just let me know. If you feel like I'm going fast, or if you don't understand, just stop me. Don't worry, okay? Just let me know. When the acetylcholine is released, where does it go? Okay, Maisa, very good question. What was I explaining till now? Yes, Maisa, I just said that the moment acetylcholine is released in the synaptic cleft, right? What's going to happen to acetylcholine? As you see over here, it's going to get degraded by an enzyme called as acetylcholine esterase, and its degradation will produce two components called as the acetate and choline. Does anyone remember what did I say last semester? Where will this acetate and choline go now after they're degraded? They will be recycled. Exactly, we said that last time. They will be recycled. Can you repeat the alpha and yes, yes, Abdul Rahman. I simply said that all you need to know in this diagram is you need to know what is this. This is the receptor for the acetylcholine. What is the name of the receptor? Its name is nicotinic receptor. What is it made up of? It's made up of five subunits. It's a protein by the end of the day, right? How many subunits are there? It has five subunits. Remember the polypeptide chains? It has five polypeptide chains related with protein chapter. It has five polypeptide chains: alpha, alpha, beta, gamma, delta. Okay, let me ask you a question now here. Is it a tertiary protein or a secondary or a quaternary protein? Okay, let me see what do you know about the protein chapter. What kind of protein is this? Is it a primary, secondary, tertiary, or quaternary? Quaternary, absolutely. Very good. Oh, very good. Wonderful. You know it. Absolutely. Very good, guys. Yes. Right? So it's a quaternary protein over here, isn't it? So with five subunits, but the acetylcholine binds to only two polypeptide chains or two subunits. One is this alpha, one is this alpha. That is all you need to know. I really don't know who asked me this question. Abdul Rahman, is it clear? And what does it form? You should know. No need to know structures. Yes, you need to know what does it form at the end. Okay, great. Okay, moving on further. Why is removal of acetylcholine important? Why do you think it's important? It's very, very important. Okay, why is it important? It's very, very important because if your acetylcholine is not removed, what will happen? The muscle is going to remain what? Contracted or relaxed? Absolutely right. So what will happen if the enzyme acetylcholinesterase is inhibited? Let's say someone is going to come and inhibit this enzyme. Let's say this enzyme is not available there now. What's going to happen? Absolutely. Wonderful. Wonderful. Everything finishes off, right? It ceases off. Wonderful. Okay. Now, very interesting thing to talk about, botulism. Have you ever heard about this before? What is botulism and what causes it?
Food poisoning?
Yes, food poisoning. Exactly. Sometimes when we eat undercooked food, God forbid, or if you eat, raw food, or sometimes tinned food, right? That undercooked or raw food is so very rich in, some kind of neurotoxins, okay, from the bacteria called as a Clostridium botulinum. Remember the name of the bacteria, okay? So botulism is caused by the the neurotoxins produced by produced by Clostridium botulinum. Okay. So what do these toxins do? Okay. These toxins, or we call them, neurotoxins, okay, they simply does not allow the release of the acetylcholine from the presynaptic vesicles, isn't it? So the vesicles, if you remember, we spoke about earlier, right? The vesicles at the axon terminal, they were supposed to get released, right? They were supposed to bind to the membrane over here. By the process of exocytosis, they were supposed to release the neurotransmitter. So do you think now neurotransmitter can reach to its receptors on the sarcolemma of the muscle cell? course not. It will not reach. It will not reach. What will happen? If it will not reach, what's going to happen? No sodium is going to end. This channel will not open at all. No sodium is going to enter inside. No sodium will enter, no depolarization, no action potentials, right? And muscles cannot contract. Muscles are paralyzed, right? And if it's not treated quickly, it can be very, very detrimental for a particular, yes, it can cause a lockjaw disease, or as long as it causes the paralysis of any muscle in the body, we are okay. Okay, but the death is certain if it causes the paralysis of the external intercostal muscles. Remember external intercostal muscles? Yes, because they help in elevation of the rib cage. So if the rib cage is not elevated, we cannot inspire. Khalas, a person is gone for a toss. Yes, they can also cause the heart attack as well, right? So that is about the botulism. Okay. So remember, it prevents the release of this. You should know what happens. What happens because of the neurotoxin? It prevents the release of the acetylcholine. Okay, but then we also have some good news. Everything in this world has two parts. If you have a good thing and then you have a bad thing as well, right? You have pros and cons for everything. If the cons are that it is it's going to be very dangerous, right? But then doctors, scientists, they showed the extraordinarily use of the neurotoxin. Okay, and what is that? That is, we all know nowadays, we all know, called as a botox injections, right? What happens? See, other than we all know about the cosmetic part of it. We all know that, okay, look at this lady. Before, she had so many wrinkles. Look at her mouth, right? After that, her these the facial muscles were, some of them were temporarily paralyzed using the botox injections, right? And she looked beautiful after that. We only know the cosmetic part of it, but do you really know that there are really some people who face with the facial tics? you know they have you know uncontrolled muscle contractions in their eye, in their face. They constantly blink their eye, constantly. They have a they can't even speak. There are some people who can't even speak. That's called as dystonia. They have involuntary muscle contraction in their muscles of the tongue, right? So all this is, so botox has come as magic molecule for those patients which are suffering with these uncontrollable muscular spasm of anything. Okay, for some people one side of the face is totally has a spasm. Where is my pen? One side of the face has a total spasm, right? So we call hemifacial spasm. They have constant twitches. You know what is twitches? We discussed about the twitches also last semester. Yeah, Tourette sticks. Absolutely, Kazi. Very, yes, absolutely. I didn't want to use that because I didn't want to use Tourette's disorder because I thought like maybe you don't know about it. But yes, Tourette's disorder is so very bad, right? And some people have a habit of repeating the last word, whatever you would say, or whatever they would say, they would repeat at the end, right? That is also part of, this syndrome, right? So so this so we, as I said, that we only know the cosmetic part of botox injections, but we don't know that how effective they are for patients like the Tourette's disorder, right? Like patients with the dystonia. Okay, so where they have, where you inject the botox into the muscle of the tongue muscle. It kind of they try to the lost motor control. Okay, or their pharyngeal muscles. Okay, so they have lost control in the pharyngeal muscles. So once the botox injections are given in the tongue or in the pharyngeal muscles, okay, it tries to relax their muscles for some time, and they are able to speak. So yeah, this is definitely a magic molecule with an extraordinarily good properties. Okay, is it clear? Now, how many of you have heard about the nerve gases? And can you tell me when it was latest used, the nerve gas? When was it used latest? And I'm sure that everybody we in Middle East, we all know that when it was used, nerve gas. Yes, when was it last? And where was it used? Nerve gas. I'm talking about these nerve gases or phosphonates present in the nerve gases. Haven't heard about it? Nobody heard about Iran Iraq war. Yes, nobody heard about, when Syria was attacked in 2000, chemical warfare, when Syria was the Aleppo city in 2017, 2013. Yes, they were attacked by this dangerous chemical weapon called as the nerve gas or a sarin gas. You might have heard, in news, you might have heard about the sarin gas, right? So this is a chemical weapon, okay, which has, yes, have you heard about, yeah, which has a drastic effect on, yes, it will absolutely, yes, it blocks the enzyme acetylcholine esterase. So that is why you need to know what was the effect. That's why I told you, you have to know what is the effect of the acetylcholine esterase, right? So this dangerous poison, this dangerous chemical, okay, attaches itself, or you can say blocks the acetylcholine esterase. So when you have no acetylcholine esterase, what's going to happen? Okay, look at this. If you have no acetyl, if this enzyme is not there, what's going to happen, guys and girls? If this is not degraded, this step will not happen. So there will be, it will be this step, right? So what will happen? Acetylcholine will constantly bind to its nicotinic receptor. What's going to, the muscle will contract constantly, the muscles will contract, and soon you will see that lot of acetylcholine which is released over here, that will start building up here in the synaptic cleft, okay, because there's no acetylcholine to degrade the acetylcholine esterase, to degrade the acetylcholine, okay. So it will constantly cause the muscle spasm. I don't want to show you the pictures, and I don't want to tell you, what all happens because of this. Just remember the mechanism of it, okay. So why I had to mention here about the Iraq-Iran war, and why I had to mention about the chemical attack done by the Syrian government on the population, so that you remember it. This is the way, people remember it. Oh, she gave us an example of nerve gas, so now you will not forget about it. What happens, because of, the moment you will remember about, okay, she said us about the Aleppo city, right? So you will not forget this. That's why I had to mention it here. Okay. Is it clear to everyone? So that was about the acetylcholine esterase. So if the question says that acetylcholine esterase is inhibited by, so you will write either it's the nerve gas or the pesticides. For example, we use, if you have to kill a cockroach, what do? You take a cockroach killing spray and spray it on the cockroach. It's going to do same thing for the cockroach as well, right? It's going to block the enzymes, right? And at the same time, yes, so soon everything, within the cockroach will come out, and that's how it's going to, I don't want to go into details, so all that. So that is about it. So you will have them in the pesticides as well, okay. So then yeah, irreversibly, acetylcholine is, I have mentioned it here, you can read it over. It's irreversibly, okay. But then acetylcholine can, acetylcholine acetylase can also be inhibited, okay, by succinylcholine, okay, and the dicamethonium bromide, okay. Don't you think so? We recently spoke about succinylcholine. Remember, we spoke about it, in the last chapter, the enzymes chapter, when we said that it is a neuromuscular blocker. If you remember, I told you that we use succinylcholine in the, when you have to give general anesthesia. It's this for the bronchoscopy, exactly. It's the same thing. It's the same thing. So you're going to give patient the succinylcholine till you want, patient to be paralyzed. Okay. And if you remember, I told you that for 3 to 8, its mode of action is 3 to 8 minutes. Okay. So succinylcholine will go and bind to the acetylcholine receptor, right? So it's the succinylcholine which is going to bind here, not the acetylcholine. Okay. And it will remain bound. Its action is a little prolonged. So by the time succinylcholine binds to the acetylcholine receptors, so the muscle is going to be relaxed. So your patient is going to be relaxed. His muscles are going to be relaxed. So whatever surgery you want to do, okay, so your patient is immobile, okay, and his vocal cords are relaxed, okay. And what happens then, as you stop giving the acetylcholine esterase is going to remove this succinylcholine, and then the normal process will start all over again, right? So we say, that's why we say uh, Hannah, I didn't understand your question there. Do you mean that acetylcholine ester inhibit the? No, 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 no. We said that. See, we said that acetylcholine esterase is inhibited by the succinylcholine, but only for some time, right? Yes, yes. This is the same slide which we spoke about, in the chapter. So, why I explained this a little faster, because we spoke about this, in our previous chapter, in the proteins chapter. If you remember, I told you that succinylcholine is a neuromuscular blocker. What does it do? If you want to paralyze your patients for any intubation, okay, for any surgery, for any bronchoscopy, right? You are going to give the succinylcholine in the form of an injection or in the form of an IV for longer time, injection for some time. For that, you have to go back to the Mariam, to the enzymes chapter. What is reversible and non-reversible? Anybody who can explain this to Mariam? This is from the enzymes chapter. What is reversible and, yes, Mariam, please read the enzymes chapter for that. Yeah, it's the same thing. Yes, dear, it's the same thing. No, no need to know the structure. No, Faisal. No need to know the structure. Yes, Hannah, dear. I'm going to. I'm explaining it. I'm explaining it. I said that acetylcholine esterase can also be inhibited by the succinylcholine. This succinylcholine is used as a neuromuscular blocker whenever you want your patients to get paralyzed for some time during any procedure. Okay, the procedure can be a dental procedure, or it can be a bronchoscopy, it can be an intubation, endoscopy, anything. Okay, so you want your patient's muscles to be relaxed for some time. Okay, so in order to make sure that the patient's muscles are relaxed for some time, you might give him an injection of succinylcholine or give it in the form of an IV. Okay, so what will happen? This succinylcholine is going to get, and let me go to the diagram so that I can explain it a better way. So this succinylcholine, where is the diagram? This succinylcholine, so instead of acetylcholine binding to the receptor, you will now have the succinylcholine binding to the receptor. Okay, so it remains bound to its receptor for a little longer time. Okay, so that a little longer than your acetylcholine. Okay, so that is why we say that succinylcholine is a muscle relaxant, or we say it is a neuromuscular blocker. Okay, and that is why we use it in the anesthesia, so that we can induce a paralysis in a patient. Okay, you want to For example, if you want to do a procedure for 10 minutes, 5 minutes, depends upon you as a doctor. Okay, did you all understand? Then what happens, the moment the moment the effect of the succinylcholine is gone, then succinylcholine is going to be removed from here, then your acetylcholine will come and it will start acting on your succinylcholine and slowly and slowly and slowly degrade it. So your acetylcholine esterase can also degrade your succinylcholine. Did you understand what I'm trying to say? Yes, not the high doses. They use it as an IV. They use it as an IV. If they want to do a procedure for a longer time, they use it as an IV. The IV line, you know what's an IV line, right? Is it clear?
Professor,
Yes, dear.
may I ask you a question?
A quick one because we didn't even finish 1/4 of the chapter.
Okay.
Yes.
So basically, like the succinylcholine, does it inhibit the acetylcholine esterase or just the acetylcholine?
See, as the succinylcholine is attached to the receptor, do you think the acetylcholine esterase is going to bind at that time?
No.
It's not going to bind, right?
No.
Okay, so what happens that your acetylcholine is totally inhibited, right? The moment you will stop giving acetylcholine, right? Then the moment you stop giving succinylcholine, then the acetylcholine esterase is, it's going to be, it's going to be active again, and it's going to start degrading the succinylcholine slowly and slowly. And then the whole, because now you're not giving succinylcholine, right? And now what will happen, your acetylcholine is going to come back and again attach to its own receptors,
Okay,
right?
thank
So
you.
all you need to know, you don't have to go into detail, just remember the reversible and the irreversible thing. And remember, it's temporarily used to relax the muscles, okay, in the surgery. That is it. Is it clear till now? Okay. So, what else? Okay. Okay. So, okay. When we're using, okay, so, so you know what is a ligand gated ion channel now, right? So nicotine, okay, the nicotine receptors, because nicotine has, it's it's a concentration dependent agonist or the antagonist. If nicotine is available in very small doses, okay, it acts as a stimulant, okay, it prolongs the receptor's biochemical response. So you can say that nicotine in very small amounts act as an agonist. Nicotine in very small amounts acts as an agonist. That means it's going to stimulate, remember the first slide, it's going to stimulate the receptor, okay. But then if nicotine is available in large doses, large quantities, right, then it's going to, act as an antagonist. And when it binds to the receptors, right, so what's going to happen, the receptors are blocked, which might cause the respiratory paralysis. So the concentration of nicotine is very important, right? At low doses, it acts as an agonist, stimulating the receptors. In large doses or higher amount of doses, it acts as an antagonist, okay, blocking the effect of the receptors, right, which might cause the respiratory failures or respiratory paralysis. Okay. So what activates and deactivates the acetylcholine receptors? Who has the answer for this question? Nicotine. Yes, in small quantities, it's going to act as an stimulant. In large quantities, it's going to act as an, yes, antagonist. Okay. What about this? What causes the inhibition of the acetylcholinesterase? Irreversibly. The question says irreversibly, okay? It doesn't say reversibly. Phosphonates, nerve gases, pesticides. Absolutely. Very good. Super. Absolutely. Absolutely. Then we have the strong antagonists here, okay? So if you remember, I told you about, God forbid, if there is, if a person got a snake bite, okay, or a scorpion bite, right? So the venom present in the snake or the scorpio, right? What's going to happen at that time? Okay, at that time, the venom will prevent the binding of the acetylcholine to its receptors. So acetylcholine, which was supposed to bind to its receptor, nicotinic receptors, it's not going to bind to its receptors. Okay. So as it's not going to bind to the receptors, what can you expect, right? It causes the muscle paralysis, right? Same thing, respiratory paralysis, and it can cause death within few hours itself. It can cause death. Okay. So and the once it's bit by a snake, right? So the effect can be produced within few minutes to the hours. Okay. And then we'll not go into details. We just want to know what exactly happens to the receptors here, right? So you just simply need to know that the muscle paralysis is caused, right, because the snake venom or whatever spider venom it is, it prevents the binding of the acetylcholine. So acetylcholine and the receptors, they cannot bind to each other. Okay. Okay. And then you have one more thing. Have you ever heard about this word curare? Do you know what is this? When was it used, or what exactly is this? It was used as the no, arrows. Absolutely, absolutely. Yes, yes, absolutely right. So we call it arrow poisons. Yes, you're right, right? So it is again a neuromuscular blocker. Okay. And what happens here, for example, if you have to shot a particular animal or a prey, right? So you simply need to put the arrow, okay, or whatever blowgun you have, it should be dipped in this extract, curare extract. Okay. So as it's dipped here, okay, and khalas, then it's a neuromuscular blocker, right? It causes simply death by the asphyxiation, right? Wherein the inability of wherein the patient is unable to the respiratory muscles will not contract, the respiratory muscles will be paralyzed, right? So this is also a nicotinic acid receptor blocker. Okay, it can also block the curare, it can also block the nicotinic acid receptor. Okay, I don't want to go into the competitive antagonism and all that. That will confuse you, because as I said, that you simply need to know the definitions. Because if I go into the competitive and non-competitive, then it might confuse you. It's a non-competitive antagonist or competitive. That's going to that's going to confuse you. So I'm not going to that. Okay. So we just finished one receptor. We need to still finish four more. So amino acid receptors. Okay. So in this type, we don't have much of the mechanisms which we spoke about till now. Most of the mechanisms are there in the acetylcholine as a receptor. In the amino acids, there are no detailed mechanisms over here. Okay. So amino acids can also act as messengers. Yes, they can definitely. Okay. And these amino acids are of two types. They can be either excitatory or they can be inhibitory. Okay, so if they are excitatory, okay, then what's they going to do? Okay, if they are, if you see here, for example, when we say, you can see GABA here, right? This is a red light. I put this diagram here so that you can remember it. GABA, for example, is an inhibitory. Like the red light, for example, it tells you to stop, right? So GABA is an inhibitory one. Okay, and the glutamate, for example, the glutamic acid or aspartic acid or cysteine, right? So this is, they're basically the excitatory. What does that mean? That means they can stimulate the neurotransmission. The way we spoke about acetylcholine, it stimulates the neurotransmission at the neuromuscular junction. So here they can also stimulate the excitatory one. Remember just what they do and remember the names. That is it. No need to remember the structures. And you know yeah, and for glutamic acid you also need to know that what is the receptor for that. The receptor for only for the glutamic acid, the receptor for the glutamic acid is the NMDA. That's what you need to know here. Okay, so N-methyl D-aspartate is the receptor for the glutamic acid. So that is all you need to know here. Okay, so now one more thing you need to know here: how do they bind to their receptors? Okay, they are also like your acetylcholine. Okay, so the only two examples in your entire chapter for the ligand gated receptors are your one, acetylcholine, which acts as a ligand, bind to the ion channels, and the ion channels are opened. And number two, it is the amino acids as a neurotransmitters. They can also bind to the ligand gated ion channels. These are the only two examples for the ligand gated ion channels. So that's how you can remember it. Rest, whatever neurotransmitters you would see, right? Rest, whatever transmitters you see, they remember that they're always G protein linked. So that will minimize your, that's how you can remember it forever. Yeah, I will repeat. It's just a receptor, just the receptor. Remember the receptor. That is it. This is the receptor. You just have to know it is a receptor. NMDA is a receptor for the glutamic acid. As I said that we will not go into, we're not going to details, and it's not even there in the book. So we're not going to details what happens after that. The way we said that nicotinic acid is the receptor for the acetylcholine. Similarly, NMDA is the receptor for a neurotransmitter based, for a amino acid based neurotransmitter called as a glutamic acid. Is it clear to everyone what I said? So you have to remember that amino acid messengers are of two types. One, some of them are which can excite a next neuron, so they are excitatory. Some of them which can inhibit the next neuron, so they are inhibitory. So remember the names. What are the names for the excitatory? The glutamic acid, aspartic acid, and the cysteine. Remember the names. And out of these three, you have to remember the receptor for only one. That is the NMDA for the glutamic acid. That is it. Okay. And then what are the inhibitory one? Inhibitory one are your glycine, okay, your GABA, okay, and your taurine and your B-alanine. So glycine, taurine, GABA, and B-alanine. Just remember the names. What if the question says that B-alanine is what kind of amino acid messenger? What is it? Is it excitatory or inhibitory? Okay, cysteine is a, what kind of receptor is a cysteine? Cysteine. Cysteine is the excitatory. That's all you need to remember. What is the receptor of glutamic acid called? It is the NMDA. The receptor, it's the NMDA, right? And how do these all, whether it's an excitatory or the inhibitory, how do they activate their target cell? By the ligand gated ion channels or by the secondary messenger system? By the ligand gated, not by the secondary messenger system. Yes, That is all you need to know. Don't go into detail, okay? And then one thing which you have to remember, okay, no need to know about this one as well, because I had explained it last year in detail about it. So, okay. Now what you need to know other than that is, yeah, you need to know how these amino acids are removed, okay? We spoke about acetylcholine, that acetylcholine is removed by the action of the acetylcholine esterase, isn't it? Now let's say the amino acid was released as a neurotransmitter. Let's say it attached to its receptor NMDA, it was a glutamic acid. But the question is now you have to stop transmitting the information from one neuron to the other neuron. Okay, so how are you going to stop all this now? Okay, how is it removed? Okay, so it's removed by the process called as a reuptake. What is a reuptake? Reuptake, simply remember that there are certain proteins called as a transporters present, and these transporters are going to send these what? Send the glutamic acid back. If you have the one neuron, you have neuron 2, right? So if your glutamic acid is now released, so glutamic acid will go back where? To the presynaptic neuron. Do you understand what I'm trying to say? How they're removed? So there's no enzyme here. Remember just the procedure, it's a reuptake, right? There's no enzyme, there's no acetylcholine esterase here, there's no enzyme here. It's just by they are recycled by the transporters, which is called as a reuptake. But then there's something else also which is not mentioned here, but there are glial cells. Remember the support cells last semester? The glial cells, neuroglial cells? Yes, they can also reuptake these, the neurotransmitters and then pass it on to the neurons. Okay, so in this slide, you just need to know how are your amino acids going to be get removed once they are used for the transmission of the message to the next neuron. Khalas, clear to everyone? Did you understand what you need to know in this slide? So the shortest of all these transmitters are your amino acids, where you simply need to know the inhibitory and the excitatory one. Remember one receptor, and remember how do they activate their targets and how they are removed. That is all you need to know. No. There's no hydrolyzing of the enzyme here. There's a reuptake. Okay.
Doctor,
Yes, yes.
so they are activated by the ligand gated and they are inhibited by the reuptake.
Yeah, they're not activated, they bind to the ligand gated ion channels, right? The way we said acetylcholine binds to its receptor called the nicotinic acid receptor, right? So same thing, you have to say that they also have channel proteins present in the next neuron. Okay, so we have a ligand. Initially, if you remember, when I started with my lecture with that, right? So if this is my channel protein here, so my amino acid neurotransmitter is going to bind over here as a ligand over here. Okay, and by the time the amino acid is bound here, the channel is open. Once the amino acid is removed, the channel will close again. The same concept. Is it clear, dear?
Yes, doctor.
Okay, and now when the amino acid was removed here, how is it going to go back to the neurotransmitter? How is it going to go back? What is going to happen to this? It's going to be reabsorbed, or it's going to be recycled by the transporter proteins. Is it clear to everyone? So ligand gated channels opens or close in response to ligands. A ligand can be anything. It can be a neurotransmitter, it can be a hormone. What are the cholinergic receptors? Right? Receptors to which the acetylcholine bind. What are the two types? We have nicotinic and the muscarinic. Right? So what kind of effect is produced by the acetylcholine when it binds to the nicotinic acid receptor? It has an excitatory effect, isn't it? because it's going to open the channel. Sodium channels are, sodium is going to move inside, and the action potential, depolarization will take place, and the action potential will propagate. Okay, any question till now? Now the adrenogenic one. Okay, do you want a 2-minute break, or shall I go ahead? Now we have to discuss two more. The
Miss, I have
steroid one is easy. Yes, don't worry. I'll give you 2-minute break. Just take a 5-minute break. Don't worry. So it's 9:35 and 9:40. We're going to come back. Okay.
Miss, I have a quick question about the
Yes, dear.
slide before.
Yes, dear. Tell me.
The first question, the answer to it is neurotransmitter or a hormone, right?
This one.
Yes.
Ligand-gated channels open or close in response to a ligand, and that ligand can be a neurotransmitter or a hormone. Yes, you're right.
All right. Thank you, Miss.
Yes, dear. So, hello everyone. Is the 5-minute break over? It's 9:40. Should we start? As I said earlier, also you can leave the class anytime, so you can always listen back to the recording, or if you feel like you really don't want to attend this class, revision class, so that's perfectly okay. Okay. So we spoke earlier when we started the chapter, we said that we have 5 different types of the chemical messengers based on their chemical composition. One we said was the cholinergic, where we spoke about the acetylcholine as a messenger, right? And where we said that it binds to the receptor, like your nicotinic acid receptor or the muscarinic acid receptor. Okay, and we said that the acetylcholine, which is bound to its receptor, its effect can be relieved by simply when the acetylcholine is released, and it can be degraded by the acetylcholine esterase. Then the second was the amino acid messengers. Of course, they are made up of amino acids, so that's why we call them as the amino acid messengers, right? So amino acid messengers are only what? They are only neurotransmitters. They cannot be hormones here. So cholinogenic messengers are also just the neurotransmitters. We don't have acetylcholine as a hormone here. And then we said that amino acid messengers are of two types. They have excitatory and we have the inhibitory. And then we discussed about what were the different types of the excitatory as well as the inhibitory, the glutamic acid, the cysteine, the aspartic acid, right? And then we have in the inhibitory one, we have the GABA, we had the B-alanine. What else was there? B-alanine, GABA, and the, I think, glycine. Yes, glycine was there, isn't it? And the taurine. So they are the inhibitory one. And then we said that how they are removed, okay, from the junction or from the synapse, they're simply removed by the reuptake, isn't it? That's what we learned in the amino acid one. Okay. Is it clear till now? Okay, and now the adrenergic one. Okay, so here you have to remember an adrenergic messenger can not always be the neurotransmitter. It can be a neurotransmitter as well as it can be a hormone. Okay, so for example, if the adrenaline is secreted by a neuron, so it acts as a neurotransmitter. If your adrenaline or an epinephrine is secreted by the adrenal medulla, it will act as a hormone when it passes through the blood. And we already discussed about the definition between a neurotransmitter and the hormone. Clear about it? Okay. Now, Now, first of all, if you remember, initially we discussed that we have two types of receptors only. As I told you, you have to remember only two types of receptors. One, channel linked receptors, and number two, G protein linked receptors, which are also called as the secondary messengers. Does anyone remember what are the only two neurotransmitters which activate their target cell by the ligand gated receptors or channel linked receptors?
Acetylcholine
Very good. And
and the amino acids.
absolutely wonderful. So excluding whatever you have after that, just push them to the G linked one or the secondary messenger one. Okay, very good. Alhamdulillah. So that means everybody is active. Alhamdulillah. Okay, great. Good to know that. Now we're going to talk about in detail what is the procedure. See, in chapter 9 we spoke about secondary messengers, very briefly. I don't know whether you remember it or not, because when I was teaching you there in the secondary messenger, I told you that we are going to discuss the secondary messenger in detail in biochemistry. So this is the time when we have to discuss secondary messenger in detail now. Okay, so what these are and how they are activated. Here it has a little longer procedure, but if you see the diagram, it becomes a little easy to remember everything. I'm going to go back. I'll go back to the diagram. Okay, but before I explain you about the diagram and how does this secondary messenger activation work, we also call it a G protein linked receptors. Let's first of all try to see what all comes in the adrenergic messengers. As I said, we will have both neurotransmitters here, as well as we will have here the hormones, right? So if the question says, just in case, if the question says serotonin, what kind of messenger is it? Okay? So you have to remember that here we have a category, we have an epinephrine, okay, which is a neurotransmitter as well as a hormone. We have the serotonin, okay, which is a neurotransmitter. We have a dopamine, which is again a neurotransmitter. We have an histamine, which is usually a neurotransmitter. Usually when I used to teach it in the class, I used to explain them a little bit about, serotonin, dopamine, histamine, but now you don't need to know about all that. You will remember it now because it's high time. We just have exam day after tomorrow. So you will just remember it, inshallah, okay? So no need to go into details what serotonin does and dopamine does and histamine does, right? We don't need to know all that. But when I explain that in the class, so I explained it with a little bit of history so that a student can remember it, what serotonin is about, what dopamine is about. Okay, but let's not discuss all that here now. Okay, so you have to know the categories, right? So the question says that dopamine, what kind of messenger is a dopamine? So if the question says that amino acid, cholinergic, peptidergic, or the steroid messenger, so you will answer it's the adrenergic messenger. So that's how you have to know each and every category. Okay. Yeah, I will repeat. I just said that serotonin is happy. Yes, I just said that we are, Mariam, talking about the adrenergic messengers. And we said that adrenergic messengers are of both types, both neurotransmitters as well as the hormones. Then I said that you need to know the categories as well, right? Epinephrine is a neurotransmitter as well as it acts as a hormone, which you of course know that, right? So then serotonin, dopamine, histamine, they are also the adrenergic messengers. Okay, and then I said that if epinephrine is released by a neuron, then you call it a neurotransmitter. If epinephrine is released by your adrenal medulla, you call it a hormone because it travels through the blood. That is all I said till now, Mariam. Is it clear? And then I said that, yes, very important point. Then I said that, yes, they're called as monoamines too. Absolutely, Sham. They're called as monoamines too. Absolutely. Okay. We also call them as biogenic amines, monoamines, right? Yes. Or for example, dopamine, epinephrine, or norepinephrine, they're also called as the catecholamines. They're different ways. I just didn't want to confuse you. So if you say dopamine, epinephrine, norepinephrine, they're also called as catecholamines, right? That is about it. Okay. Now moving on further, now with the receptor, now we know that they activate the target cell, or they activate the postsynaptic neuron by the what kind of receptors? The G protein linked receptors. Okay, remember this word G protein, because I know that every student has a habit of calling, even I have a habit of calling it a secondary, because we all have studied that, in chapter 9 we've studied that, secondary messenger system, right? But you can call it definitely as a secondary messenger system. But what if you get a word, suddenly you get a word like, oh, G protein linked receptors? You will be like, oh my god, what was that about? I only knew about the secondary receptor system. So remember, they are the G protein linked receptors, and in a while I'm going to explain you why they are called as a G protein linked receptors. Okay, so we're going to skip all this. All this I'm going to explain you with the diagram, okay, because we have a beautiful diagram coming up. Remember this diagram from chapter 9? There it was very simple, though it would have been very simple here as well, but here it's not very simple here. There we simply said that if you have a primary messenger, okay, which could be here I can say that which could be a hormone, which could be a neurotransmitter. It can be an epinephrine, norepinephrine, or serotonin, dopamine, histamine, right? And we simply said that it binds to the receptor, right, forming the hormone receptor complex, which cannot travel because of the plasma membrane, right? It cannot travel to the plasma membrane because of the hydrophilic nature, right? And then we simply said that it activates the enzyme and converts ATP into cyclic AMP, and it is this cyclic AMP which will produce a response in the target cell. So the basic concept remains same, right? But in between, there are many other things which are going to happen over here. Okay, this enzyme, we have a name for this enzyme. We have a name for this, and we call it an adenylate cyclase enzyme. So let's go to the diagram which is there. So these are types of the secondary messengers. This is the same slide from our chapter number 9. So definition of sometimes you get just a definition of secondary messenger. What is a secondary messenger? So if you remember, I told you earlier also, secondary messenger is something when, for example, I just had one neurotransmitter. Let's say this is not a hormone, this is a postsynaptic neuron. Okay, let's not see the target cell. Okay, if it's a neurotransmitter like serotonin, dopamine, histamine, or epinephrine, so once it binds to the receptor, and all these things happen here. So as I have a secondary messenger produced, I just had one molecule attached here, but the response produced here will be many fold. Look at this, isn't it? So I have plenty of cyclic AMP produced, or a plenty of secondary messenger produced, which can actually increase or the signal, right? Which can increase the signal many-fold, right? So that is the importance of your secondary messenger. Let's try. So it can greatly amplify the strength of the signal. That is the role of your cyclic AMP. Any questions till now? Aileen, I did not explain that yet. I did not explain I'm going to explain it now, Aileen, okay? Now, this is the slide where I'm going to start now, okay? Explaining what all happens here, okay? So this slide is just an overview, okay? But you can just read this also, but this is actually the real one is this one. So this is like a step-by-step, it's showing you what is happening. So please pay attention. And it's very easy to remember. It's like a cascade pathway, one activating other, other activating other, other activating other. Okay. So, so how is we're talking about how your adrenergic messenger, which can be a neurotransmitter like serotonin, dopamine, histamine, epinephrine, or I repeat, or even a hormone, right? A protein-based hormone, for example, right? How that is going to activate your, the target cell. That's what we're going to learn here, okay? So let's say this is my, so please everyone pay attention. Let's say this is my primary messenger. As I said, it can be a neurotransmitter or it can be a hormone as well, right? So this is like a same step what we learned here. This is like a first step here, the primary messenger binding to its receptor, okay? So as it binds here, so what we have seen that, so this is a ligand, isn't it? So primary messenger or a neurotransmitter acts, or a hormone acts as a ligand here. And this is the receptor over here, okay? So the moment ligand binds or a hormone or a neurotransmitter binds to its receptor, what's going to happen? The receptor is going to change its shape, okay? Or you can say the receptor is going to get activated, okay? As this receptor is activated, it binds to a protein. We are not interested to know how many subunits of protein are there, but actually there are many subunits here as well. I'm not going to tell you all that. Remember simply binding of a neurotransmitter or a hormone to its receptor changes the shape of the receptor. As the receptor changes its shape, what's going to get activated? Your another protein called as a G protein is going to get activated. Are we okay till now? Okay, now I have an activated G protein. Okay, now this activated G protein is also going to get turned down. As I told you, this is a cascade pathway, one activating other, other activating other, other activating other, right? So now my G protein is activated, isn't it? So now my G protein is on, it's turned on, it's activated. It also changes its shape, okay? And as it changes its shape, not shown in the diagram over here, it releases the GDP. Look at this, GDP is coming out, okay? And what is binding to it? GTP is binding to it. Are we okay till now, guys? Step one, neurotransmitter or a hormone binds to the receptor. It forms a hormone receptor complex or a neurotransmitter receptor complex. The receptor changes its shape, okay? It gets, finally, it's activated now. This further activates another protein called as a G protein. Now the G protein is activated. When G protein is activated, it's going to release the GDP and GTP is going to get attached here. Okay. Now it's about the energy. No, it's not about the gap and all, it's about the energy, Fatima. Yeah, Fatima, right? It's being supplied with the GTP, it's being supplied with the energy over here when it binds to the GTP. GTP is like an ATP, energy source over here. Are we okay? So look at this. Okay, now once we have this, let me erase this first so that because it is clear. Okay, once we have GTP attached to it, okay, which has given us the energy, okay, this further activates, as you see, it further activates another enzyme which is called as the adenylate cyclase. So this is basically the same pink one which you see. The pink one here is an adenylate cyclase enzyme, right? So it is the adenylate cyclase enzyme which is activated here. Okay. Now, adenylate cyclase is an enzyme, isn't it? Yes or no? It's going to catalyze some reaction. Yes or no? Okay. Now, what will it's going to catalyze a reaction? It's catalyzing a reaction wherein it is converting ATP into a secondary messenger called as a cyclic AMP. You will not forget ever this cyclic AMP is a secondary messenger. This is a very important point to note here, that cyclic AMP is a secondary messenger. And here, this one, which is a neurotransmitter or a hormone, is a primary messenger here. Okay. Now, what do I have last? I have now cyclic AMP produced. Okay. What is the ultimate job of cyclic AMP? The ultimate job of cyclic AMP is to open this channel, ion channel, which is closed ion channel. Please pay attention, everyone. The ion channel is closed. The ultimate aim of all this secondary messenger system is to open this ion channel. That is our aim over here. If you remember, when we, so that the ions can flow, absolutely, Faiza. If you remember, in the channel linked receptors, in the ligand linked receptor, it was so simple over there. They were no, that is why that mechanism was very fast. We simply said there that we have a receptor, okay, to which the acetylcholine binds, it's a ligand, and the channel is open. So that one is pretty much faster than this one. Sometimes if the question says that which among the following is the faster, fastest pathway, right? Is it the, if a messenger or a neurotransmitter has to activate its receptor, right? Which of the two processes is faster? It is the same thing, right? It is the ligand gated one is faster than, of course, the G linked one. Because look at this, there's so many steps over here. It's going to take few minutes for cell to do all these things. Okay, are you okay till now? Okay, so I said that my aim, or the aim of cyclic AMP is cyclic AMP is to open this ion channel. Okay, so but still we still have one more step to reach over here. What is that one more step here? This cyclic AMP is going to, okay, activate another enzyme, and this enzyme is called as a protein kinase. So this protein kinase was an inactive enzyme. Look at this. Its components R and C are hugged together, R and C are hugged together. But the moment cyclic AMP is produced, this R and C are going to get separated. Look at this. See, cyclic AMP is attached to the protein kinase enzyme, right? And just in case if this diagram is there for labeling, so remember this is a protein kinase enzyme. This is adenylate cyclase. This one will be easier to label if it's there for labeling. And this is the G protein. This is the receptor, and this is the primary messenger. Okay. And now once we have cyclic AMP, if it binds to the enzyme over here, okay, what's going to happen here? It's going to what? The R and C are going to get separated from each other. So R and C is basically, the C is the catalytic unit, okay? The part of the enzyme which can actually catalyze the reaction, okay? So as this enzyme is activated, finally, what do we have? We have this enzyme separated out. Once we have the enzyme separated out, finally, there will be a second molecule of ATP, not actually shown very closely over here, right? Yes, it's shown over here. So it's going to phosphorylate here. Yeah. So there will be a second molecule of ATP, which is going to get converted into ADP and release one phosphate. That phosphate will bind to the catalytic unit over here, right? So as phosphate is bound to the catalytic unit here, now khalas, right? This enzyme is going to do what? Look at this. What is happening here? What is happening, guys, here? It's going to phosphorylate. Remember, we spoke about an enzymes, about the phosphorylation and dephosphorylation. If sometimes the enzymes are phosphorylated, they become active, or if they're dephosphorylated, they become inactive. By just adding phosphate group to an enzyme, it can either activate an enzyme or deactivate an enzyme. We learned all that, right? Yes. So if you see here, that is what's going to happen here. The catalytic unit is further going to phosphorylate this ion channel. As it phosphorylates, now the channel will be happily open over here. The channel which was closed over here, look at this. And now things can easily move. Now the gate is open. So look at the phosphate is attached to it, right? So that is how the channel. So this was the ultimate aim of all this process. When cyclic AMP binds to the protein kinase, yes, dear, right? See, as I said that cyclic AMP is going to activate this protein kinase. Okay, so how is it going to activate the protein kinase? It's simply going to activate by dissociating its R and this C component. Okay, so as R and C component is, if you see here, as this protein is activated, right, R and C are separated here now, then the second molecule of ATP, okay, it's going to, then there will be one more ATP molecule which will be converted into ADP and the phosphate, and what will happen then, it's going to get attached to this catalytic unit. Okay, and this catalytic unit will further phosphorylate now to the final thing, which is, what is the final thing? Final thing is a channel protein over here. So 2 ATPs are needed in the process, absolutely. And finally, how was the channel opened? The channel was opened by the phosphorylation, isn't it? Because by the end of the day, it is, channel protein is, it's a protein by the end of the day, isn't it? It's a channel protein, right? So it opened its door only after it was phosphorylated. But it had to go through so many steps, and finally the channel was opened. Is it clear to everyone now? So just these diagrams, just these, if you know these diagrams, okay, these are very, the function of Faisal, tell me, regulator, what is the job of regulator in enzymes? Yes, Faisal, tell me about the enzymes. Did we speak about regulator in the enzymes? So when regulator and the catalytic unit are bound to each other, the enzyme is inactivated. Yes, the enzyme is inactive. So it's inhibited when the regulator is bound to the catalytic unit, right? So when they are separated, now regulator is not bound to the enzyme. Now enzyme is happily active now, isn't it? Yes, dear. Yes. Okay. So that was about it. And then it says that there is one more. Okay, this was about, G protein linked receptors. But then it says that the diagram is not shown over here. Okay. But then it says that there is one more. Okay. There is one more, G protein linked receptor here. Okay. But here it involves the phosphatidyl inositol diphosphate. Okay, here we do not have adenylate cyclase or the protein kinases, okay, especially, but here the molecule is PIP. So that is only, the rest of the processes are similar. It's just that we have an inositol based compound here, but the process remains same. So there's no diagram over here. So you can simply say that G protein linked receptors, right, are one where we have, all those enzymes, adenylate cyclase and protein kinase. But then we also have one more where we do not have adenylate cyclase. Instead of that, we have the PIP2. That is all you need to know. Okay. And yes, it says about the release of calcium. So one more thing which you can know over here. Do you remember last semester when we spoke about muscle contraction? Do you remember when we said that calcium is stored in the sarcoplasmic reticulum? Do you remember all that? Yes, right? So this type of activation system is basically when we have to release the calcium from the sarcoplasmic reticulum. Okay, when the muscle has to contract, it's when the action potential has reached to the sarcolemma. Okay, after that, the calcium which is stored in the sarcoplasmic reticulum, that is to be released, right? And when it has to be released, finally what happens, that calcium will finally go and finally bring about the actin myosin binding, and the muscle will contract. So at that time, when the calcium is released from the sarcoplasmic reticulum, right, at that time when it enters into the cell, it uses this pathway, right? G-linked, G protein linked receptor pathway, but here there we have the inositol based compounds. So that is all, nothing much. Okay, just we do not have adenylate cyclase here, we have PIP2 here. Where is it used? It is used when the calcium has to be released from the sarcoplasmic reticulum so that the muscle can contract. These are the only two things which you need to remember in this slide. Yeah, to initiate the muscle contraction, absolutely, absolutely. Okay, yes, Island, I will repeat it, don't worry. I said that we spoke about this pathway, right? Here we spoke about, we have an, let me erase all this. We spoke about, we have an adenylate cyclase enzyme, right? This was the main guy, right? So who mediated all these things. But instead of adenylate cyclase, we have, there's one more pathway which is used, in the muscle contraction. So here we have PIP2. That is all you need to know. There's no adenylate cyclase over there. Did you understand what I'm trying to say? Because you were not with us last semester, because last semester we spoke about how, the special kind of smooth endoplasmic reticulum, how they store the calcium in the muscles. Okay. When that happened, yes, Mariam, I just explained it to Aileen, right? I just told her you need to know, need to know here that if there is no adenylate cyclase over here, we just have, instead of adenylate cyclase, we have PIP2 here. That is all. And where do we use it? We use it when we have to release the calcium from the sarcoplasmic reticulum so that the actin and myosin can bind together. You remember the sliding filament theory? Sliding filament theory. Okay. So this is the same thing. No need to know the structure. This is the same thing. How your adenylate cyclase produces the CAMP. How your adenylate cyclase, this one, produces the cyclic AMP. This is the same thing. Okay. But it's telling you in the form of structures. So no need to know the structure. Okay. No. PIP is not used for the muscle contraction there. I said that, Hannah, see, we are talking about G protein linked receptors, right? So these are the receptors to which either a neurotransmitter can bind or a hormone can bind. Okay, Hannah? Then there's no adenylate here. Then this G protein linked receptor is basically, here we have two types of molecules present in between. Okay, in one process, we can simply have just the adenylate cyclase, which I explained you earlier. Okay, adenylate cyclase. And then in one more process, which is used in the muscles, in the sarcolemma of the muscles, right? There we do not have adenylate cyclase. That process is mediated by PIP2. This is the only thing which you need to remember here in this slide. Hannah, did you understand what I'm trying to say? Yes, this is, I mean, not for the muscle. It's basically, the specific way to say this is when the calcium has to be released from the sarcoplasmic reticulum, because there's a long process of, activating its, the receptor, and yeah. Okay, so that is, rather than saying for the muscles, the best way is to say is that when we have to release the calcium from the sarcoplasmic reticulum. Okay. Okay, then it's trying to say that this is the same thing what I explained you. It amplifies the signal, cyclic AMP, it increases the signal. It's the same thing what I explained you, right? Okay, now the question is, how will all these things stop? Okay, the question is, absolutely, Kazi. Yes, yes, Hakam, you're right. There we're using adenylyl cyclase, and there are many other changes also, but since they're not mentioned in your book, we'll not go with that. There are pretty much minor changes as well. But in a broader perspective, you can say that yes, there we had an adenylyl cyclase. Instead of that, we have here PIP2. Okay. Okay. Now the question, how will all these things stop? This whole pathway, right? The pathway we just spoke about, how will all this stop? Gada, how can I tell you the question now? So whatever questions which I'm asking is like, I'm just kind of, I'm posing the question so that the concept will be clear. So I told you that the question might be, for example, I'm just making a wild guess, okay? So the question might be, for example, here, okay, the G protein linked receptors, okay, for example, they can what kind of, intermediate molecules are used in the G protein linked receptors, okay? So you can have adenylyl cyclase or you can have the PIP, okay? And you can also say that here, so the PIP based pathway is basically used when the sarcoplasmic reticulum has to release the calcium. So it's released, it plays an important role over there. Okay. Yes, the concept questions. Yes, dear. Did you understand what I'm trying to say? Okay. So moving on further, we were discussing how does the simple signal amplification stop. Okay, my question was basically, how will all these things stop? Okay, if you have to stop the whole process. Okay, of course, the primary messenger will be dissociated from its initial receptor, isn't it? Okay, so when your neurotransmitter or the hormone simply dissociates from the receptor, what will happen? Do you think adenylyl cyclase will be formed here? We'll go back to the diagram here. If this is not there, right? Do you think G protein will change its conformation? No. Do you think GTP will bind to G protein? No. Do you think adenylyl cyclase will be active? No. Do you think cyclic AMP will be produced? No. Right? Do you think R and C, which were hugging each other, now will they be separate from each other? No. Do you think the phosphorylation of the protein will take place? No. Do you think another ATP molecule will come here and cause the phosphorylation of the catalytic unit? No. Do you think it will further cause the phosphorylation of the ion channel? No. All these steps will not be there. But what if I already had some amount of cyclic AMP there? That can be possible, right? The way we spoke about in if acetylcholine binds to its receptors, okay, and what if no new acetylcholine is released from the synaptic cleft? What if some amount of acetylcholine is there that's attacked by the acetylcholine esterase, and it breaks it into its acetic acid and the choline, right? That's what we learned there. But what if I already had some amount of cyclic AMP already produced here? What will I do? And I don't want anything to be activated. I don't want this channel to open again. Do you understand what I'm trying to say? Yes. But what if I have the cyclic AMP, then there will be an enzyme called as the phosphodiesterase, which will simply cause the hydrolysis of this cyclic AMP, break it open, right? And it will give you just the AMP. Did you all understand? Yes, destroyed by the enzyme phosphodiesterase. Clear? Any questions? So this was all about, how this will stop, and then what else? And then there is one example over here of the Vibrio cholerae. It's okay. I mean, if you want to just read, it's just an example. You can just read it. Okay. I had given I had actually attached a diagram also here, but it's not so very important. Just read it. Okay, if you want to, you can just go through it. It's the same thing. The cascade of pathway, G protein, adenylyl cyclase, and so you can just read it out. Okay. Now there's one more way of removal of the transmitters. Okay, so body can inactivate these neurotransmitters by simply oxidizing them to the aldehydes. Okay, and if they are oxidized to the aldehydes, okay, because now you don't want neurotransmitters to be there, right? So what will you do with the neurotransmitters? You will simply convert those neurotransmitters into the aldehydes, as you can see here. Epinephrine and norepinephrine, we don't need them now, right? Our job is done, everything is done. Now they are converted into their respective aldehydes. Now what is important to know? You have to know which enzyme catalyzes the reaction. It is the monoamine oxidase. That is all you need to know here. Okay, if you want to remove your adrenogenic neurotransmitters, they are removed by a special kind of enzyme called as MAO, which is a monoamine oxidase. What does a monoamine oxidase do? It simply converts your neurotransmitter into its respective aldehyde. Now it's no more a neurotransmitter. When it's no more a neurotransmitter, do you think it can bind to the receptor now? Do you think the aldehyde can bind to the receptor now? Khalas, it cannot bind, right? That is how you removed or cleaned up the site over here. Okay. I really don't know what happens to the aldehyde. Let me ask our body what happens to the aldehyde. Mr. Hakam, whole day there are so many toxins and chemicals produced in our body. Do you really want to know what will happen to all these? I told you last time, there's so many. Our body is a big chemical reaction, chemical factory. Whole day there are plenty of chemicals which are released. But they should have included, I will next time I will include this slide to you. What will happen to the aldehyde? If it's not there in the book, why do you want to know that, Akam? That too in you when in the last moment of the exam. Okay. That's okay. That's okay. I was just trying to make the situation lighter. Don't worry. Okay. So where were we? As I told you that this chapter was so very long, right? If I would have, usually, as I said, that this chapter was for 2 weeks. 2 weeks would mean 6 plus 6, 12 hours. I mean, not 12 hours, 3 plus 3, 6 hours, right? So, but we are going good, okay? So till now, every concept you have understood it, right? Till now, we are all okay about it. Okay, interesting, very good. You find it interesting? Alhamdulillah. Good, alhamdulillah. Good. Because some concepts are, kind of similar, what we learned in PHSF. Okay. So yes, so that means, so there was one way of removing your neurotransmitter was simply you catalyze, still surviving. I agree. I agree. Don't worry, God is there to help you all. And I'm constantly, profusely praying for you all. Trust me. I just remember that I'm constantly praying for you all, for everyone. Everything will be fine, inshallah. They're easiest to understand so far. Yes. Yes, I too think so. Thank you, Fatma. So don't worry. You'll be all okay. It's all about, just work harder. You just have one day left tomorrow, and then on Sunday also you have half a day. So just try to revise, revise, and revise, and revise, and revise. Thank you there. Thank you. Yes, but sometimes when you think chapters are easy, okay, so sometimes when the concepts are very difficult, it's something very easy to crack a hard nut, right? So sometimes easy things are like you take things for granted, okay, but then things come up to you as a surprise. So don't think that they're easy. Just study everything, read everything. That is the key point. Yeah, this chapter is very long ideally. As I said, that this chapter is basically as per your syllabus, it's for 2 weeks. It's scheduled for 2 weeks. Okay, but that's okay. We just have few concepts left, and then we are all okay, I think, inshallah, hopefully. Okay, quickly. Now, what do we have? We have one more way to remove the, adrenogenic neurotransmitters. Okay, and what is that way? That is a simple way that after attaching themselves to the postsynaptic membranes, what's going to happen that when the signal is all over, when everything is all over, okay, simply your neurotransmitter will come out of the receptor. It's going to dissociate from the receptor, and it will be reabsorbed, reuptake in the presynaptic membrane and stored back again. Okay, it will be, do you know what I'm trying to say? It will be, there's one more way. So it will be removed here, okay, and then we will have axon terminal over here, okay. It will go back into, it will be there will be a reuptake, and it will be stored in the synaptic vesicles again here. That is one more way of removing the neurotransmitters from the synaptic vesicle. Clear? Yeah, reuptake and then storing them back again. Okay. And then histamines, okay? The action of histamines is basically here, you just have to remember that it is again similar to the other monoamines synthesized from histidine. Histamine as a neurotransmitter is formed from the histidine, okay, by decarboxylation. No need to know the reaction. Okay, what are the receptors? Remember the receptors. H1 and H2 are the two receptors, okay, for what? For your histamines, okay. And these two receptors are found at two different places in our body. So their distribution is different, okay. H1 receptor you'll usually find in the respiratory tract, especially in your smooth muscles. In the we spoke about bronchioles yesterday, in the respiratory system. So, and we spoke about they have smooth muscles, right? So those smooth muscles are very rich in the receptors for the H1, okay. And you'll also find them in the blood vessels, okay. And then what about the H2? You have to know the location of these receptors, guys, everyone, okay. So remember the locations as well, okay. So H2 is basically, you find it mainly in the stomach, okay. So H1 in the smooth muscles of your respiratory tract, right? In in the bronchi, and then you'll also find it in the blood vessels. So that's why the word vascular is here, blood vessels. Okay, while as H2 is confined to the stomach. Okay, because in the stomach, I don't want to go into detail about it, because in the stomach there are special endocrine cells, okay, which constantly produce these histamines. Okay, so so sometimes you might have heard that when there is a lot of acid secretion in the stomach. Okay, so to decrease that acid secretion, doctor might give you H2 blockers. I don't know whether you have heard about it or not. So doctor will give the H2 blockers, right? So it's the same thing, that histamine present in the stomach. I think you should remember, you can remember up to this point. Yes, remember we have histamines as a neurotransmitter. There are two types, H1 and H2. Remember that the location where they are found, remember how they're blocked. So this is like a medications which we eat, whenever we have, you might have heard that, whenever we have any kind of respiratory tract infections, right? The asthmatic attacks. So, yes, so we are given by the, the allergic attacks, we're given antihistamines. So remember uh, the the medications, and this is like a ranitidine and cimetidine, right, which is given to decrease the release of the hydrochloric acid in the stomach. Okay, that's it. So no need to remember the effect of it. Okay, okay, now which group of proteins, yes, they're G protein linked. Yes, absolutely. Yes. So remember that, okay, I will tell that at the end, because so that you don't forget. If as I said that uh, G protein linked, I think I told you earlier also, the channel linked one are all only the acetylcholine and the amino acid neurotransmitters. Rest all of them is G protein linked. I repeated that I think twice before as well, right? So they are G linked. Yes, they're G linked. Okay. So which group of extracellular messengers most often activate G protein signaling pathway? So which will come over here? So can we say monoamines? Yes or no for monoamines? Adrenergic. Yes. And in a while, we're going to talk about the peptidergic, right? They will also be here, right? Yes. So do we have here amino acid neurotransmitters? No amino acid. Do we have acetylcholine here? No acetylcholine. Remember that. No acetylcholine, and yes, and no amino acid. Rest everything is there. Okay. This is the same thing which I explained you earlier. Okay. Now we move on to the second last type of neurotransmitters, called as the peptidic messengers. Okay, and why they're called as peptidogenic? Because here we will have neurotransmitters which are as a short peptides. You know what are peptides? What are peptides? Did you read the protein chapter? What are peptides? More than 50 or less than 50?
Less than 50.
Yeah, thank you for remembering that. Very good. They're not very long, Tasneem. They're less than 50. Yes. Shorter. Yes. Shorter polymers of amino acids. Absolutely. Short peptides. So peptides are smaller than the proteins, right? Less than 50. Okay. Now, this is like, this part you're going to enjoy, because this part, I don't know, I enjoy teaching this part because I find it very interesting. Okay. I don't know about it. These type of receptors called as, so, okay, one question first. Do we have only neurotransmitters as peptidergic, or the hormones as well?
Hormones as well.
Exactly. You will not forget the classification which I said earlier. Adrenergic, peptidergic, and steroid messengers. All of them are not even not only neurotransmitters, they are what? hormones as well. Both, absolutely. Right. So here in short, what you have to remember here is, we have a neuropeptides here. Okay. So neuropeptides, if you remember, I don't know whether you remember or not, when we spoke about, there are some hormones which are made in the neurons. Remember? Do you know which hormones are made in the neurons? We call them neuropeptides. Can you name any two neuropeptides secreted by the posterior pituitary gland? No ways.
Oxytocin and the other.
Oxytocin and the ADH. Yes, absolutely. Very good. Right? So oxytocin and ADH, they will be in this category. Okay. Because they're neuropeptides, they are formed by the cell body of the neurons in the hypothalamus, right? And then they are released and stored in the posterior pituitary gland. That's one thing over here. Okay, so we'll have hormones here like oxytocin, we'll have ADH called as neuropeptides, and we will also talk about insulin and the glucagon over here in a while. Okay, in this category. Okay, but then the interesting thing which I enjoy teaching is what are the kind of neurotransmitters here. The neurotransmitters here are your enkephalins, your substance P, and the neuropeptide Y. Do you know what are enkephalins? Have you ever heard this term before? What are enkephalins? Does anyone? Have you ever heard this term before? Oh no, reduces the pain. Yes, very good. Reduces the pain. Absolutely. You're right. Reduces the pain. You are right, right? Natural painkillers, right? You might end up eating a painkiller, but enkephalins are basically your natural painkillers, in our brain. Okay, so enkephalin is a neurotransmitter, okay, which is released in the brain. It is brain's own pain regulator neurotransmitter. Okay, so as I said, that the way you eat a painkiller, okay, you might go ahead and eat a painkiller like a morphine or anything, right? But then brain has its own painkiller, which is called as an enkephalin. Okay, have you ever noticed that sometimes uh, we are in an argument, not we, like, or like, let's say XYZ, a person is in an argument, okay, or he's fighting with somebody or fighting with the attacker, and somewhere he's hurt, but he does not realize that, oh, I have such a huge cut on my finger. I didn't even realize that. Did it ever happen with you when you, God forbid, you had a small cut or something, and you didn't even realize that? Yes. Do you know why is it so? Yes, it happens when we are basically, when your brain is thinking something else, right? Because at that time, what happens, okay, our own, and that is like a natural mechanism, okay, our brain, it has its own pain suppressing system, it has its own analgesic system, to take care of any kind of pain. Okay, so in our brain we have something called natural opiates, right? Natural morphine is produced in the pain. Okay, and these morphine, they simply reduce our perception of pain. And when does that happen? When we are in a stressful condition. Okay, do you understand? Or sometimes, for example, you're writing a biochemistry paper, you don't even realize that you were so engrossed doing your biochemistry paper, and you literally inserted your nail into your skin. You didn't do it deliberately, right? Absolutely right. So this happens when we are in a stressful condition. Or not only that, you might have heard that a person, a shruta, or a soldier who's fighting, who's fighting in the battlefield, right? He might be hurt, or God forbid, he might have been attacked, but he will continuously fight because he is in a stressful situation, and in this stressful situation, the brain activates the enkephalins. So what are enkephalins? They are the natural what? Painkillers produced in our brain. They are also the neurotransmitters. Are we okay? Do you know, have you heard about, I just wanted to share this interesting thing with you because we are about to finish now in a while. Not now, in a while. Have you heard about acupuncture techniques? The Chinese acupuncture? Have you heard about that? Yes, that also works. That also has the same thing, when you do acupuncture, so it produces the loss of pain sensation. You don't feel the pain. It's okay, Omar. No worries. That's okay, dear. No problem. That's perfectly okay. It's okay, right? So acupuncture, it is also based on the same perception, right? So when you do acupuncture, the Chinese technique, what happens is that it basically produces or increases these opiates, or natural painkillers, in our body, right? uh, in our brain, and so that's why you don't feel the pain. So that is the real mechanism behind the acupuncture. See, Umar, why my screen is spoiled, Umar? Does that mean I should not teach anymore? Is that is that an indication that we're tired and please don't teach us, Umar? Is due to release of enkephalins? Yes, yes, Akam. Yes, Akam. Yes, because at that time also we are in a short-term stressful situation. It's okay, Umar. No worries. It's okay. But I just want this to be clean. I don't know how will, because I need to teach. How can we clean this? Do you mind cleaning this? It's gone. Okay, thank you. Okay, so that was about the enkephalins. Okay, and all you need to know about them. That's all you need to know about them. Okay, and then what are the substance P? Before I could explain you about neuropeptide Y, what are the substance P? Substance P is P for pain. That's how you remember it. Substance P, are also neurotransmitters which are released by our neurons. Okay, their main function is they usually, transmit the pain input. For example, if I pinch you on a skin, right? So from the skin, okay, we do have a receptors, pain receptors over there. So from those pain receptors, the information is taken to the central nervous system, okay, where you realize that, oh, I have been pinched, right? You will perceive that pain, okay. So that's when the substance P is released, okay. And then we have, in the brain we have an enkephalin. It will try to suppress that substance P, right, if we are in a stressful situation. Okay, that is all you need to know. And I think that's it you need to know. And then what is the, no, that's all you need to know about it. Okay, and then the neuropeptide Y. Neuropeptide Y is simply it's produced by the hypothalamus. Okay, and this is called as an appetite stimulating agent, neuropeptide Y. It simply increases the food intake and tries to store that food as an energy, okay, as a fat. Tries to store that food as a fat in the form of an energy. So simply, it's a control mechanism for food intake. Okay, and then if you remember, we spoke about chapter 9 in leptin. Okay, leptin is basically when the receptors in the hypothalamus are blocked by the leptin. Okay, let's say these are receptors which are blocked by the leptin, the hormone leptin. Okay, so appetite is suppressed. We spoke about it in chapter number 9, how appetite is suppressed and activated. Okay, that is your leptin. So in short, neuropeptide Y is also a neurotransmitter. Don't forget to remember, if I ask you, for example, what kind of neurotransmitters are categorized in the peptidogenic one, so you have to say it's the substance P, neuropeptide Y, and the enkephalins. And then we'll talk about in a while about the hormones now. Those are the only three neurotransmitters which you need to remember here. And of course, how do they activate? They activate by the G protein linked receptors, their target. And now we just need to discuss about the hormones, which are the peptidergic hormones. Okay, here we'll talk about the two hormones. We'll just talk about the glucagon and the insulin, the pathway, how they activate the target cell. Okay, so quickly tell me, what is the job of glucagon? I will be able to explain it to you only if you know what is the function of glucagon. And you should be knowing all these things, guys. Read about the hormones which are mentioned over here. Just give a quick reading about those hormones. What do glucagon do? When to increase the glucose? When see Ramadan time is coming, right? When we're hypoglycemic, it increases the blood sugar, isn't it? So during Ramadan, for example, we will not eat from dawn to dusk. So it will be the glucagon which will take care of it, isn't it? Yes. Do you remember the glucogenolysis and glucogenesis? I told you we're going to use that in the last chapters of biochemistry when we did glucagon in chapter 9, right? So the glucagon is capable of doing glucogenolysis, that means breaking the fats and the proteins and releasing the releasing the energy. Sorry, gluconeogenesis, using fats and other proteins to produce the glucose, right? And non-glucose resources and producing the energy from them. And then the glucogenolysis, where it is breaking the glycogen to release the glucose in the blood. Is it released by the alpha cells or the beta cells?
Alpha.
Alpha cells. How does it activate the target cell? Which mechanism? Direct gene activation or the G protein linked secondary messenger system? The G protein linked, yes, the secondary messenger system, absolutely, very good. Okay, so then here we have one diagram over here. So all this I will explain you in this diagram. Okay, so please concentrate on this diagram here. What is our aim here? The aim, when do we produce glucagon? We produce glucagon, the aim at that time, our aim is to increase gluconeogenesis. What is gluconeogenesis? When you use the what? Non-carbohydrate resources to produce the glucose, right? So that is our aim. Okay, and at the same time, our aim is to block glycolysis, because we don't want to break down the glucose now, because there's no glucose in the body already, right? We don't want to use glucose, isn't it? Okay, and now look at this. Look at the mechanism. What's happening here? We have a receptor, and this is the glucagon, right? So first, the step one, glucagon will go and bind to its receptor. That is step one. Okay, as it binds to the receptor, okay, so it's going to, now the GTP thing, it will be activated, phosphorylated, and finally, in short, we have adenylate cyclase. It's the same thing, hormone which will bind to receptor, the G protein will be activated, it will activate the adenylate cyclase. It's the same thing, right? And finally, we have the cyclic AMP. Okay, this adenylate cyclase will convert ATP into cyclic, and the same process, right? And now what is going to happen? Okay, because of this, we will have the cyclic AMP dependent protein kinase will be there, and it will simply inactivate an important enzyme called as the phosphofructokinase. This is the phosphofructokinase. Remember, our aim is that the glycolysis should not take place. The glucose should not be break down, right? So that is why by doing all this G-linked, linked receptor pathway or secondary messenger, by the secondary messenger pathway, okay, what we did finally is we actually inactivated our phosphofructokinase. Okay, so how is this inactivated? It will be inactivated and it will be as it is phosphorylated. Look at this. Okay, it is inactivated because it was phosphorylated by this ATP. So now it's phosphorylated, that means now it cannot actually show any kind of work in the cell. Okay, so all this happened just because the glucagon was attached to its receptor. Okay, now once we have the phosphofructokinase 2, which is now in blocked mode, okay, it's totally in the blocked mode, it is inactivated. Okay, but at the same process, by the same process, okay, by the G protein linked pathway, what's going to happen? By the secondary messenger system, we will have activated one more enzyme. Remember the name of the enzymes? That's called as the fructose bisphosphatase 2. So this enzyme is also phosphorylated, but when this one gets phosphorylated, right, it gets activated. Okay, so this is inactivated and this is activated. Okay, but the combination of both of them, combination of this and combination of this, it's going to lower the activity of one more, just remember the enzymes here. One more enzyme which is called as a fructose 2,6 bisphosphate. Now you will tell me, what is the importance of this enzyme? This enzyme is very, very important in the glycolysis. Okay, so in short, by the deactivation of this enzyme, by the activation of this enzyme, in short, this is further going to decrease the activity of this particular. So this enzyme is in low quantity now. Are we okay till now? Are we okay? Okay. I will show you the name of the enzyme over here. This is the enzyme over here. This is the enzyme. This one. So our aim is to reduce the activity of fructose 2,6 bisphosphate. That is our aim. Okay. Are we okay? Did you all understand? Okay. Now, by simply lowering the activity of this enzyme, right? So what's going to happen? So this enzyme, the phosphofructokinase, okay, this is going to be inactivated, right? And it's going to suppress the glycolysis. No more glycolysis will take place in the glucose. No more glucose will be used to produce the energy. Rather, what do we want to do? We want to produce more and more glucose because we are not eating anything, right? We are not eating anything, right? So this will cause the activation of the fructose bisphosphatase, right? And this enzyme will be activated, and this enzyme can be used to use my proteins, my carbohydrates, and produce more and more glucose by the process of gluconeogenesis. What was the ultimate aim? The ultimate aim was to increase gluconeogenesis and stop the glycolysis. Yes, so CAMP is required for absolutely. So it basically activated, CAMP, and then it did the job. It did the job for both the enzymes. That was about the glucagon. Is it clear? So remember the enzyme names, okay, and which one is activated and which one is inactivated. And then the last topic here is for the peptidogenic neurotransmitters is hormones, is basically the effect of the insulin. What is the effect of insulin? Why do we produce insulin? What is the role of insulin? It's capable of doing what? Whenever my cell needs glucose, whenever I eat food, right? It's going to,
glucose
yes, it's going to decrease the glucose level from the blood. It's going to send that glucose or penetrate that glucose into our body cells, right? So our body cells can absorb that glucose in presence of the insulin. The process is called as the glucogenesis. Okay, and and other than that, not the process called, then it also does the process called as a glucogenesis, right? We also store some amount of extra glucose in the form of glycogen. Okay, now what happens here again, it's the G protein linked receptor, but there's a little twist over here. Okay, here we don't have a long pathway of a hormone binding to a receptor, then G protein getting activated, then it changing its conformation, then adenylate cyclase getting activated, then CAMP producing, then protein kinase produced. So we don't have so many steps over here. The only steps which we have here is, look at the diagram over here. Okay, and in this diagram, what is happening? This is the receptor for the insulin. Okay, so in this is the insulin which is bind to its receptor. Okay, the receptor for the insulin is the tyrosine kinase. Okay, so which is the tyrosine kinase has basically two different subunits. This whole thing is tyrosine kinase, guys. This whole thing, and girls, this whole thing is tyrosine kinase. It has two subunits, alpha subunit and beta subunit. Okay. Now what's happened? If you see here, alpha subunit is present on the extracellular side, on the outer side. Okay. Whereas the beta subunit is present within the plasma membrane. Okay. So when you release the insulin, and when insulin has to go and bind to its target cell, it binds to the alpha part of the receptor. Are we okay? When insulin binds to the alpha part of its receptor, okay, it causes its autophosphorylation. Okay, what does that mean? As you see here, look at this. Phosphate is being added to the tyrosine residue of its beta subunit. Okay, I will repeat once again. Insulin binds to its receptor. It will bind to the extracellular part of the receptor called as the alpha subunit. Okay, so binding of insulin to its alpha subunit will cause the autophosphorylation of the tyrosine amino acid residue, but that is present on the beta subunit. Okay, and simply now you can say that this whole enzyme, right, this tyrosine kinase is now active because of phosphorylation. It got active, right? So as it is active, then we have a target protein called as the, what is the target protein over here? IRS. Okay, this is the insulin receptor substrate. Okay, now what happens? This insulin receptor substrate is now phosphorylated. As you can see here, now look at this. It's now phosphorylated. So the moment this is phosphorylated, khalas, it's going to make whatever changes it has to make. It's going to allow more and more glucose. It will allow more and more glucose to be transported into the cell. Okay, so that is about the how insulin activates its target cell. The process is almost simple. We also call it a G-linked pathway or a secondary messenger pathway, but it's little different than what we learned previously. So that is So then you will, yeah, then you will read about, I'm not going to explain this. You will read about type 1 and type 2 once again. It's the same thing what we have already discussed in chapter number 9. So you just read it. You can read it from here or you can read it from chapter number 9. Okay. And then you can, this is the same thing what I have been explaining. You can just read this out. And then finally, steroid messengers. Again, it's the exactly same thing what we learned in chapter number 9. So the direct gene activation, right? It's going to, is used by the steroid hormones, okay? And that is it, okay? Okay, so except the steroid hormones also act as a neurotransmitters, and just remember their receptors. That's it. Rest, it's the same thing what we learned in chapter number 9. So the steroid ones is very easy. There's nothing much about it. It's same as we did in chapter number 9. Okay. And even the difference between type 1 and type 2 diabetes, don't think that I did not teach you. I am not teaching you just because we have already learned that in chapter number 9. It's too easy to just need to read it and know what it is. But that does not mean you will not study about it, right? And that is it. With that, we finished the chapter. Finally. Thank you. Thank you. Thank you for staying back as well. Thank you for staying back. What time did we start? We started at 8.
8.
I hope I should be able to upload this long presentation in this long video. But you know, last time, you know, a day before yesterday, when I added the video as a link, you all were able to download the video, because longer videos I'm unable to, you know, upload on the Moodle. Thank you, Noor. I saved you, right? Inshallah. I'm expecting a very good grades from all of you now. Like I said, everybody, whether you're belong to Dr. Muhammad, Mr. Muhammad, or myself. Yes, we are done. Yeah, we are done with all 3 chapters, alhamdulillah. Thank you, Leen. Thank you for acknowledging that. Thank you, everyone. Don't worry. I will definitely upload the video after this, but you know, give me a minute. Everything is stuck. My screen is totally stuck. I can't do anything. It's totally stuck. Yes. Do we have everybody here? Yes. Thank you for reminding me that, Mohammed. Thank you for reminding me that. Yes, I wanted to talk about the project thing. You're right, absolutely. Okay, listen to me, everybody, please. And since I am not going to stop the recording, did I stop it? No, I did not stop it. So that the other had, thank you, everyone. Yes, I just wanted to tell you about yes, I wanted to tell you about the you know, how do you need to send the topics to me, because I have been getting a lot of emails. Okay, I'm going to share the screen with you. Okay, I'm going to let you know how you have to submit the topics to me. Okay, are we all connected? So please don't leave, everyone. Just wait for 5 minutes so that I can show you how you just need to send me the topics now. So I will explain you in the next class how to prepare. I will also give a presentation on that. Don't worry about that. I will give you a presentation, how to make a research report and all that stuff. But as of now, the submission of topic is very, very important, right? So if you send me an emails are like, you know, they're kind of, you know, I can't keep a track because every day I have, mashallah, so many students. I cannot keep a track of the emails because I get so many emails, because, you know, that last year, you know, I did last year with the email thing, but by the end of the day, it created a lot of mess. So this time I just wanted to be a little organized so that, you know, there's no mess created. Give me 1 minute. I'm going to share a screen with you so that I can show you how you need to submit the topic. just the topic. Okay. Uh, you, then I'll let you know how do you need to prepare that. Okay. I'll give a presentation on that as well. I'll try to make it as easy as possible. So give me a minute. I'm just trying to give me a minute. Mm. Okay. So just let me know when are you able to see my screen or not? Okay, just give me a minute. I'm trying to share my screen with you all. Can you all see my screen? Is it visible? Yes. Yes. Okay. Okay, great. So you need to submit the topic. Okay, this is the place where you're going to, let me get my pen here. This is the place where you will submit your research at the end. Once you, not at the end, because you need to check the plagiarism, which I will explain you in the class, don't worry. Okay, because plagiarism should be less than 20. Okay, because if, for example, if I show you, give me a minute, how do I keep this pen back? I just need to keep the pen back, stop annotating. Okay, yeah. So for example, once you will be ready with your presentations, clear my drawing, give me a minute. I hate this, clear all my drawings. Okay, okay. So I will stop annotating. Okay, look at this. This is like a similarity percentage, this one over here. Okay, so this is a similarity percentage, right? Here it should be, less. It will show a block to me as well as to you, right? And it should be less than 20%. That's very, very important. It should be less than 20%. But that I will tell you in the class, all those things, right? So because we do have grades for that as well if it's more than 20%. Okay. So this is somewhere where you need to submit your research once you're ready. But right now we are not submitting the research, right? So right now, what are we submitting? Right now, this is the topic where you need to, this is a place where you need to submit your topic. See, I can see your submissions like this. Look at this. Okay, I have students have already submitted the topics. Okay, so people have submitted the topics through email, so please submit it here. Okay, so once I have a date here as well, so there'll be no confusion of oh, I submitted first. No, you submitted first. So it's like a first come first serve. Okay, based on this, what I will do when I have to grade this, what I'm going to do is I'm going to write it over here. Okay, I can write it with the pen that, okay, approved, or not only here, I can also write it here in this column. Give me a minute. There should be a comment column here. For example, I will write here as, I'm going to write here as, give me a minute. I'm going to write here as APPROVED. So you should, as I save this, so you should be able to see this. Okay, my topic has been approved. Okay, so in short, what you need to do is, for example, you simply need to upload as a PDF, because I will not be able to see if it's not a PDF file. That is very, very important. So in this PDF file, you will simply write your name and your topic. That is it. Nothing else in this. Okay, is it clear for everyone? Did you all understand how you need to, because right now we are only concerned about the topic. Okay, because right now you start researching your material and everything, then I will tell you, what is the format and what are the things which are important, which you need to make sure that that if this is perfect, I can get good grades. If this is perfect, I can get good grades, right? What all needs to be perfect so that you can get maximum marks, right? So I'll explain you all that, the different parts, each part has been given few points. Okay, now that I will explain you in a good present. And the references are very, very important, right? The format of the references. So all these things are important, which I will explain you. I'll give a presentation in the class, okay, when I'll explain you all these things. Can we delete our submission if I want to change something? You mean to say submission in the sense, the topic submission or the research submission, Noora? I just wrote the name of the topic. Yeah, that should be okay, Lean. That should be okay, Lean. No problem. Yeah, you can delete it till 15th April. You can do anything with it. But because I usually used to have students, for example, once they prepare their topic, they upload it, see their percentage. Oh, if it's more than 20, they delete it and then resubmit it. Yes, you can do all that till 15th. But right after 15th, you cannot do all that. Okay. I'm going to do that, Jude, today. Yes. As soon as the topics are coming, if they're in the email, then I'm not going to, give them approval in the email, because email creates as I said, that it creates a lot of confusion. So I just want to avoid the confusion. So yes, I'm going to write, because I'm going to, after this, give me a minute. Okay, so after this I'm going to review maybe today or maybe tomorrow. Okay, I'm not today, I'm tomorrow. I'm going to send you the email or upload in the comment section that it has been approved. Yeah, that's okay. If it's outside a topic, no problem at all. The idea why we are asking for approval is, the idea is basically we don't want that two people should share the same topic. That is the main idea. That is why you need an approval. That's what Fatma said. Once you submit it there in the Moodle, and I'm going to approve it there, okay? As a comment. It will be there as a comment. Okay, is it okay for everyone? No problem, Shatha. No issue at all. Anybody anything else? Should I stop the recording?